Were we not supposed to talk about the two delegates for the fundraising committee for the arena today?
No, that's coming next week.
Next week.
Next week we got it. Because if I put it on this one, we'll make a decision to. Still no? Yeah. Oh. Okay. Yep. No, I'm good.
Well, I see it's gotten to 9:30. Good morning, everyone.
Good morning.
Welcome to our, thank you, Joan. Good morning. Welcome to our committee of the whole meeting for today, September 16th. I'll call the meeting to order at 9:30, and I will inform everyone that All members of council and our municipal clerk are here in attendance. The territorial land acknowledgement. We respectfully acknowledge the township of Allen Cullinan is located on the Mississaugan-Anishinaabe territory and is the traditional territory of the Mississaugan-Anishinaabe. The township of Allen Cullinan respectfully acknowledges that the Mississauga Nation are the collective stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. I'm going to move on to the agenda, approval of the agenda. The motion is that the agenda for the committee of the whole meeting held today on September 26th be approved. Can I get moved and seconded? Moved by Deputy Mayor Stover, seconded by Councilor Booth. Any discussion? All in favor? That's carried. Disclosure of pecuniary interest or general nature thereof. Anybody have anything to declare? Deputy Mayor?
Through you, Mayor Lowell, I have a declaration to declare. It has to do with 11.1 on the agenda. It has to do with Q2 finance reporting, and particularly the library board, and that is due to continued litigation. Thank you.
Okay, that will be duly noted. Moving on to delegations, and today we have 3. Our first one is a hall rental fee delegation, and the person presenting today is Darlene Barrett on behalf of the Alderville Pioneer Group. Is Ms. Barrett here? Anybody heard? Have you heard anything, Cassie, regarding Ms. Barrett?
No.
Is she online?
Nope.
Well, we'll move on and if you're ready, we'll have to, let her in. Or we will let her in, I should say. Okay, next we have 5.2, which is the draft municipal office structural report. And today we have attending with us is representatives from Pitchen Group. And the first person I'm going to mention is Ali Aleski. Close enough?
Yeah.
Thank you. And then Ali Yusuf, who is the Vice President of Building Systems and Resilience. So gentlemen, please come forward. As I recall, council as a whole wanted to come to if we had any questions, but why don't you tell us a little bit about yourself first? Your picture.
Okay. This better? Yeah, perfect. Okay, so my last name is a bit hard to pronounce, so you can call me Ali. I'm a senior forensic engineer, senior project manager at the Building Science and Sustainability Group at Pension. We're based in Mississauga, but we offer services, throughout GBA. I have 3 degrees in civil and structural engineering, bachelor degrees, master degree, and MPhil, Master of Philosophy and Engineering. I did the assessment, the visual structural review of 10.836 County Road 2, and I'll be happy to answer questions as we proceed.
Thank you.
Okay, thank you. Anybody have any questions regarding this presentation? Okay, go ahead.
I don't have any questions, no.
Okay, I'll start it off because there's too many questions. The last report that I looked at, I'm going to talk dollars and cents first, is the $450,000 for my understanding that would be to remove all inside materials and dispose of them too.
Yeah.
Okay, so is there a cost to dispose of some materials that are bad or not?
Well, because of the age of the building and because we currently don't have information related to how old these finishes are or the gypsum board and, wall and ceiling finishes when they're installed, there are concerns or actually, there are concerns that they were installed before 1987. So asbestos, which is a hazardous substance, is a concern here. To do the abatement, the cost of the abatement is the major cost or major item that contributes to this cost. If we, as we said in our RFQ submitted in May 2025, if we don't find asbestos, the cost for the removal and disposal of these finishes will significantly drop, just as mentioned in that RFQ.
And what is significantly drop, can you give us a little bit?
Well, we still need to get, that's all based on the testing. Sometimes for the area of that building, for the surfaces, ceiling, walls, I don't think that we're going to remove anything in the flooring, but that can go between 250K to 300K if asbestos is present. If asbestos isn't present, that would go to like more than 10 times lower.
More than 10 times so.
Probably, more or less.
So that makes a big difference. And what is some areas of the facility and not in others?
So,
Because there is, historically, there's two buildings there.
yeah.
And one was, that we think that there were, in one of the reports, I got the impression that there's been done something recently. Well, there may have been something done recently, but originally those two buildings were basically built at the same time, in the 1860s.
Yeah, based on my understanding, the main building was constructed in 1858.
Yes.
The little addition was constructed in 1986 to 87.
But the original, the one that you're talking about, might have been modified slightly in 86 or 87, but the original home there was built in the 1860s or 1870s as well.
Probably, could be.
No, I don't.
Yeah.
Yeah, but the structure itself dates back to that year, but we're not sure about the finishes because, regular maintenance, this building could date back to, let's say, 1920, for example, but you may have installed these finishes last year, for example. That's where the uncertainty is present.
So when did asbestos become, part of the construction for gypsum board?
So in the 60s, 70s, most building materials used asbestos containing materials in them.
Okay.
So the majority of construction that we see normally in between the 50s, 60s, 70s up until like late 80s will include asbestos in a high degree, right? Compared to buildings that we see right now, right? The only determination factor, if we do take samples and make sure that samples are tested, and then we confirm 100% that there is asbestos actually in those building materials, right? The differentiation between having asbestos and not having asbestos is the disposal of the building materials, as there will be certain procedures and regulations that needs to be followed from health and safety perspective, right? That extends to like enclosures, wearing masks, certain masks, using subs that are trained for asbestos removals and dispose it in certain sites that are suitable based on the regulations.
Okay.
And that's basically why the cost is much higher than if it was, asbestos. As we mentioned earlier, the cost will drop significantly if there's no asbestos, but the only way we know if we do test the asbestos, right?
So I'm assuming that price that you're presenting was a worst case scenario.
That's the worst case scenario, correct?
Okay.
Because we didn't have enough information at the time.
Go ahead, Kathy.
So I'm looking at the report in front of me, and are you referencing the hazardous materials testing for 12,500, and that will answer this question?
Correct.
Correct. So if it's mine, through you or to you, Chair, is that not what we decided as a council that we wanted to proceed with that?
I don't know if we decided anything, but I think that's why we brought in the experts in to see what, to get a better understanding, that's what my answer is, but I'm happy to hear that.
If I may contribute. Apologies. Yeah. Oh, yeah. It's not very- Yeah, it is highly recommended that the testing goes first, so that it gets you a better, estimate for the overall cost for, construction in total, right? Without the testing, it's only any contractor that we talk to, they look at it and they include the risk factor to it, which drives the price much higher, right? So, I would recommend, and this is what we do every client, we do the testing first, and then come back to the council and say, this is what we found, and this is the exact abatement cost that we take for this building, right? Without that, it's just a throwing a dart in the dark, right?
Thank you. Anybody else have anything? Just go ahead, Deputy Mayor.
Through you, Mayor Lobo. I remember when I was selling a house, I did the testing myself, and I did a little bit of research, and I understand there were two mines, one had asbestos, one didn't. What is the material?
Yeah.
What would be in the mine that would differentiate between that would be asbestos?
Yeah, it's kind of really difficult to tell from just, this material is asbestos, that material isn't. It's not by the look.
No,
It's
yeah, I
by, it's by how that material was manufactured at the time.
understand. Okay.
Asbestos is a very unique substance that used in the previous times to make things cheaper, stronger. Like it has a much better effect on building materials. That's why it was like a boom in the industry. However, unfortunately, it's very fine material that if a human being or any being inhale, right, could damage the lungs really significantly and badly, right? Now to come back to your question about is it really easy for somebody to identify? No, it has to go to the lab and the lab
I
will
did
identify.
that.
Yeah.
I did all that.
Yeah.
It was in the insulation.
And the insulation is one big thing. Caulking around windows is another one. Paint, it's another one. Around joints is another one. Hardwood is another one. Plastic is another one. Like you name it, it's kind of extends to every single building material that was manufactured in those eras.
Mayor Lobo,
Yes,
just to follow up, if I may.
sure. Go ahead.
When did it first start? When did they first start incorporating asbestos into building materials? Because the Arcandric building is an older building.
Yeah. No,
I
that's
just wondered.
That's a wonderful question. The answer to that is that they started in the 50s, 60s in the last century. However, the risk with building age is not about when the building was built. It's about all the activities that has
In
happened.
additions.
Now, I don't know, maybe there was a painting job that happened in the 80s or the 70s on the building, or caulking that was added or whatever. That contributed to asbestos availability. However, it's not always the worst case scenario in buildings, right? When we do projects similar to this project, we do something called project specific designated substance survey. So project specific DSS, right? And we're not going to go and test every single building material because that's going to be costly. What we're going to do is to really create a project specific as test, just tailored to your project, right? To confirm or disconfirm the availability of asbestos within the building for that very specific project. Now, if you have in the future, let's say you're done with your project, if you come to do the roof, maybe next year, let's say, right? You're still going to need a DSS for the roof, right? So it's always whenever there is a construction project, by the regulations, we will need to do project-specific designated substance survey.
Okay, listen, we're gonna test, if we go ahead and do the test, we're gonna test everything, including the roof and not including the roof. Because I thought it was a comprehensive.
Yeah, so the test will be tailored to the project. Whatever the scope of work will include, it will confirm the availability of the space, whether
The main building, you can see that it's kind of a clear roof, you see it exposed, but the smaller building, which, like, in the smaller building, it has an attic, and the building insulation in the attic can, in theory, contain asbestos. So, like, in that sense, the concern is more in the smaller addition or smaller building.
How many, I know there was one concern that we talked about at one time, and that was whether, when we would do the testing and when we had to completely remove, any activities in the building for that time of day, or for the 2 weeks that we'll do the test, to do the initial test or whatever. Is that, how do we address that?
for the asbestos, you mean?
Yes,
Yeah, you're referring to. For the most part, the samples we take, they're insignificant in size, and they should not affect the building operations. That's a general statement.
Oh,
Yeah, so, unless like we kind of need to do like a, little test class, for instance, in the drywall, for instance, right? We're going to coordinate with the building operator to, address that, immediately as well, to repair it or paint it or whatever, just temporary, or close it for that time being, right? But for the most part, getting the samples, like all we need is like a small piece of the building to just look at it under the microscope, right, and do the testing.
and would you do that on a weekend? Or
We could, like, we're flexible, like, we have, we have multiple offices close by, so we will be coordinating with the closest office here, so we have an office in Kingston, we have an office in Oshawa, in Peterborough, right, so all these offices will support, so we will work with the building operator to make sure that this is, the operations are not affected by it, right? So.
and then the people are, that's what.
The people, you mean the users, the building users.
Yes.
employees.
Yes.
Anybody else? Go ahead.
Through you, Your Worship. Thank you for being here to answer questions, and I'm just looking at my previous notes, and I guess I have a couple of questions. One the mayor did ask is if the testing can be well staffed are there. And I did think that we had discussions around agreeing that we would have to do the testing no matter what. But my big notes here that I had, and I stand to be corrected, is there was a few companies that bid, but only 2 that we were looking at. And I think the difference between the 2 companies, yours and the other one, I have more written down here, but I don't know if that's them, is you're recommending complete removal of everything right down to the joist. When this other company was saying that they would do selective, so they would go in and cut things and not remove everything. So in your professional opinion, you're saying that everything would have to be removed, the finishes and everything right down to the joist, or because it seems to be different from this other company?
Sure. Well, this depends on what question are we answering. Like we have several, let's describe them, several deficiencies in the building. We can target each of them or a combination of them and do that localized assessment and tell you, okay, this dip here on the washroom, for example, the report needs repair. The bouncy floors on the second floor that could be enhanced. But if you want us to say, is the building safe for an occupation, let's say for 20 years, we need to see the building. This building is relatively old. It's wood construction. The global observation or the observation of global, stiffness reduction tells us that there may be something with wood. Like all designs tend to be less, to have less stiffness. So we know that, but we're going to see if rotting or any deficiency in the wood has progressed. So yes, to answer your question, we can target specific locations and give you a report on condition assessment of these locations, but for the whole building, we need to see the whole structure.
Okay, thank you.
Anybody else have any further thoughts? Steve, you have a comment? Okay, I think you've answered, everything that I was thinking about. Oh, how many holes would you think you'd have to do? Did you do 10 for the whole building or 150 or is there an answer to that?
Is that again for the asbestos, right? For the asbestos system?
Yes.
I don't have an immediate answer to that. I can double check with my hazardous materials team and let you know, but it really depends on how many building materials available as well within the site. When they come to site as well and they look at something that they think it could contain asbestos, they take sample, right? So it's kind of not easy to tell you an exact number, but I can double check and perhaps email you a rough number, maybe like a range or something.
Yeah.
Right. I can do that.
Okay. And I think Rick was a good question too, regarding, do we, look at the small things that we're suspicious of, or do we look at the whole building? Because, and I'm not a structural engineer or nothing like that, but if we look at the 6 things that somebody has pointed out in a physics, or in a quick walk around and said, these are potentials. We could fix all of them and still not have something that we would be happy to say that you're going to not have a concern for the next 10, 20, 50 years.
Sure.
And that's why you have to, that's why you're recommending that the whole building be properly assessed.
Correct. Correct. Yeah. Addressing the most pronounced deficiencies, if we can call them deficiencies, is relatively easy. We can target these locations, but again, there are slopes and dips throughout the floor, let's say the main floor, and bouncy floors on the second floor. So this is more of a global issue or global, more. This is more general than having a dip here or a slight slope there. So again, what we're answering, if we're doing a comprehensive assessment, we need to remove all definitions. Walls, beams, joists, we may be able to deal with the floors through the crawl space, but we will end up removing a lot of these finishes. If you want to answer or if you want to provide an assessment of the whole building, it will be a full removal of these finishes.
You mentioned globally a couple of times. I'm not just quite sure what you're referencing.
I mean here in the sense that the whole, for example, here the whole floor is sloped or has a dip. Globally here means globally within the structure, meaning that you can see it almost everywhere.
Oh, okay.
Like I recall slopes and dips towards the walls, which are supports, almost everywhere on the main floor. So I just refer this to globally, meaning globally, but within the structure everywhere.
So my understanding of it, and I think we're kind of getting an understanding, but I'm not going to commit anybody to anything like now. But basically, I understand you suggest that we do a look around and see, take 10 or 20 or whatever samples and find out what we got there, and then we decide where we go from there. Is that basically correct?
Yes, I would. That's my recommendation. That's what we need to do first before we are able to tell you a class B estimate, let's say, closer to reality, right? On another note as well, it's really good to understand that your intentions for the buildings long term as well, because that also will determine whether you would like a selective assessment now versus global removal, right? Or full gut of the building, right? So I may pose a question back to you all just to think about it and say, what's your long-term plan, 5 to 10 years with this building, right? Because that will determine also if the price is a concern for the council, rightfully so. I think we can always help you navigate through options, right? But also we need to know what are your intentions. So like I go back to my design team and we look at the options and recommend what's best for you. And we always, as professional engineers, we put the public at the forefront, which is public safety, obviously. That's what matters the most, right? And then after that, then we look at options to minimize the cost as much as possible for the intent you'd like to use the building for. If that makes sense.
Yep, that makes all sense in the world. I'm gonna jump off the subject a little bit, well, I'm staying on the subject, but, the other day when I was, standing outside the building, I was walking in, and it was a nice little, older lady that was, from Germany, I believe it was. And her husband is from, Europe, another country, I can't remember which one it was. And they come to Canada once in a while, and she's staring at the building from the outside, of course. You just don't see buildings like this around here anymore. You just don't see it. She says, I come from where you see it all the time.
Yeah.
But to have it here, it's.
So, that answers a lot. So the building is iconic, right? It means a lot to the people, people living around, right? So, as I said, like I go through this discussion with clients all the time. The best thing is to tailor design with, a product that supports you, right? Doesn't mean that you're gonna spend $450,000. It means that we're gonna provide you with the best value for you, and then rest assured, like we're not after the people's money here. We might want to make money, but at the same time, want to make sure that you deliver what you deserve, right? And this, I know you're doing your best to serve the people, which is important to us as pension, because we started this company. Our founder, Down Pension, started this company because of the asbestos, right? And because it's hurting people, and it wasn't a bad thing that time. And then it was the first company built, to serve people, right? Similar to what we're trying to achieve, right? So I'm more than happy to, work with you to tailor the product that you will need for the intent of the building use.
Anybody, question? Oh, okay, go ahead. I'll let Councilor Angel go ahead.
To you, Mayor. I guess, excuse me. I guess with all the questions, a lot of good questions, it'd be nice to have a summary process, other than setting up dates. But it'd be nice to hear a summary of the process of how it's all going to happen. And your idea of how many samples and stuff that are going to be done. So I'd like to see that, if that's possible.
Yeah, I agree. And I don't think we're gonna take a vote here, nothing today, but we will give staff directions on how to proceed. Go ahead, Deputy Mayor.
Thank you, Mayor Lobo. We're right on my wavelength.
Oh.
As I'm talking or as I'm listening to you too, you are putting us kind of on the hot seat. What is it you want to accomplish here? So I think it would be a good idea. I guess even looking down the road, because there is, chances are you're going to get into asbestos here, that we should be looking at going ahead with the testing. And it's not going to be as invasive as I originally thought. You're just going to be, not just, but you're going in there and all over. And I don't have the cost in front of me for that, but that would, the ballpark for that figure, did you have an idea?
For the testing?
Yes.
Yeah, we do. I think it's
$12,500. And the biggie is taking the walls out.
Yes.
And the biggie is taking the walls out.
Yeah, if there's asbestos, the big thing is the disposal, the process, the procedure based on regulations for disposal of asbestos.
the abatement.
Which is called abatement.
And then we get into
And
the
then,
structural.
yeah.
So we are in, 1, 2, and 3, and what is it that we need here? So I really look forward to the next steps.
Sure. Yeah. What,
I mean, rather now just like kind of a quick outline of what's gonna happen, we're gonna do a visual, or let's say now it's intrusive assessment, review and assessment of the structure, the wood structure from inside.
The wood structure.
The wood structure, it's mainly wood frame. And that review will tell us if the building has some age, like 10 years, 5 years, 20 years, with the repair that we're gonna suggest or not. There may be some reinforcement of some beams, posts, joists.
Was another question I was gonna ask, so thank you.
Yeah, because that's the intent of the assessment. I mean, the ideal situation is that we tell you, okay, the structure can go for another, let's say, 20 years with no repairs. That's the ideal, but typically it would go like, we need to reinforce this and replace that generally. We're gonna also be testing some bricks from outside, for freeze-thaw consolidation and porosity and capacity, because these are old and you see like some of them have already installed. So that's just a general outline. We can tailor it more once we see how the structure is doing, provide more plans for the repair or fortification of the building based on that. But the main obstacle now is the removal of these finishes to expose the structure from the inside.
Okay.
And of course, there's, I mean, if that's what we're discussing structurally, but there are other parts like the mechanical assessment, the roof review, these are relatively easier. But again, circling back to the removal of the finishes. That's the answer.
Thank you.
if I may add to that as well. So the assessment from the outside, right, but the bricks or the roof, as well as the mechanical systems, is much easier because it does not include removal, as Ali mentioned, it does not include the removal of the asbestos materials, right? The asbestos materials, if any, right, they're hidden within the finishes that you see around, right? The structures, the structural elements, columns or beams or whatever, they're behind. So we can't see them unless we expose it, and that's unfortunately the biggie, or unfortunately the higher cost here.
You can use that term.
I like it.
But it really makes it a major difference whether it is asbestos.
100%.
Because the way I understand it, that 42,000 or 425,000, we dropped to 50,000 or something like that. If all you have to do is tear it out and put it back in.
The strikings are easy.
Yeah.
if they do not include, harmful materials, right? The problem is when you, if the materials are harmful, like asbestos in this case, right? You need to back them in a certain way, put the, like double tape and another bag, wear a mask, and then close it, and like level 3 enclosure, people, they go in and out. It's way more involved than what we think. It's labor intensive, and regulations are extremely, rightfully so, very stringent.
Yeah, you don't want these asbestos fibers to be airborne because
I
they're
know.
going to be there, especially when they land on surfaces, they're going to contaminate them forever. So that's pretty serious.
Okay. Anybody else have any further questions? Okay, well, thank you very much. Before you get up, I'm going to do the thank yous, and then I'll read my little speech. I want to thank you both, Ahmed and Ali, for taking the time to be with us today. You've answered, in my thought, you've answered a lot of questions, and we can move forward. And I look forward to seeing you.
Just to confirm, do you require anything from us, or we just wait for a decision from you at this point? So other than the number of samples, right? Would you like us to provide any other clarification to you, through email or anything like that?
I don't need nothing really, just, maybe a little bit of a plan.
Sure. We can give you like, if you would like, we can give you like a rough process, as you mentioned, right? These are the steps, right, that we would follow, right? And then we'll give you the limitation of the asbestos, right? A work plan per se.
Yeah.
Right, that's
And you're dealing with Dave.
Yes, we have to.
I'm always one phone call far away for that building or any other one. And I like driving east. It's beautiful. So anytime you need me, I'm here. For this and all other buildings, I'm here. Same as that.
It's a bit of a drive from you from Kitchener, but, you know, I'll be near to you.
I'm glad you made the trip. Thank you very much.
Thank you.
Have a great
Have a
day.
great day.
Thank you, you as well.
Okay, I'll read the resolution as prepared, as recommended. The committee of the whole received the presentation from Ali, Senior Project Manager, and Ahmed Al Yusuf, Director of Building Science from Hitchin Limited, regarding the draft municipal office structural report for information. I give the group a second. Moved by Deputy Mayor Stover, seconded by Councilor Ainsworth. Any further discussion? All in favor? That's carried. Next, we have a presentation regarding physician recruitment in Northumberland. And I believe we have Andrea here now. Andrea Groff, and she's the executive leader of the Ontario Health Team of Northumberland. And I believe Dr. Cameron is going to be on the street or no?
He's virtually.
Oh, virtually.
Yes,
Pardon me.
Dr. Cameron has clinical responsibilities and
Okay, so I met, Andrea last week at, different functions, and we just happened to be bumping in, and I said, Lord, Alan Coleman says I'm gonna be there next week. Well, she took me by surprise. But we're happy to have you.
thank you very much. I'm happy to be here. Thank you in advance for your time and a few moments to talk a little bit about the Ontario Health Team of Northumberland and physician recruitment here in Northumberland County. And I'm Andrea Groff, Executive Lead of the Ontario Health Team of Northumberland, and I'm here with Dr. Fraser Cameron virtually, who is our physician lead for the Primary Care Network Physician Group.
Okay.
So thank you very much for your time. So today is really just about information and to be here in person, give you the opportunity to ask any questions that you might have about the OHT or physician recruitment or anything related to healthcare. Just a little bit about Ontario Health Teams. So there are 58 Ontario Health Teams across Ontario, and we're funded through the Ministry of Health and through Ontario Health in order to work towards building a more sustainable and connected healthcare system, very much with the patients and caregivers at the center of those discussions. So the reason OHTs exist is to make sure that locally communities have a voice in the healthcare system, so that the mandates and directives that come down from the Ministry of Health make sense and work within the communities that we serve. I'm the executive lead. I'm one of the very few members that are paid members of the backbone team, we call it, the Ontario Health Team. But really, when you think about the Ontario Health Team, it's a collective of healthcare providers and healthcare organizations throughout the region and throughout the area. So I'm one of the paid members, but when you think about the Ontario Health Team, it's really all of our partners that work together to connect that system.
So, you mentioned Northumberland and Ontario Health Team. Do you look after specifically Northumberland, or someone else does that, and you look after all of Ontario or whatever?
I'm just Northumberland County. So I'm the executive lead of the Ontario Health Team of Northumberland, and we represent Northumberland County, west from Fort Hope, east to Brighton, north to Campbellford, and Bewley and Elderville First Nation is a part of our county as well.
Okay.
We have 2 hospitals in our county, several primary care clinics, family health teams, community health center, community care program. These are all really important partners within our OHT. Some of the things that the Ontario Health Team does is we have a website to help our community to navigate the healthcare system. So myself, having been raised in healthcare and worked in healthcare for decades, the healthcare system is a very complicated world to navigate or to find our way through. And part of what the OHT does is to support people to navigate that system, to find the right services at the right level for their needs. And we do that through a navigation hotline where community members can call, or even providers can call and say, hey, I need help finding, food bank services, or are there any walk-in clinics in my area? We have a hotline in order to support that. We also have a really cool website that has some referral forms that are built into it. So it's easier for the community to just really quickly put in those self-referrals and access services. And we're constantly building and evolving our website so that it's a one-stop shop to help our community understand what's available in the healthcare system in Northumberland County. We work a lot with technology to help make things flow better within the healthcare system. We've been doing a big project on online appointment booking for primary care providers to help fund and help get it off the ground so that your family doctor, family nurse practitioner has online booking, so you can go on and book an appointment online. Makes it easier for patients out there to be able to, if you wake up first thing in the morning, you don't have time to sit on the phone and try to get through clinics, you can book an appointment through online booking, and we're supporting that movement. We also have the Rural Outreach Clinic, which is a community-based service to provide some primary care access for those who don't have access to primary care. We're doing a lot of work in the primary care space right now. We have a primary care network, which is the physician group, nurse practitioners who work in primary care, and primary care clinicians and primary care leaders coming together to help solve the challenges in primary care. If you're not familiar with the term primary care, it's basically that family doctor, family nurse practitioner that is your home base for your health care. They help you with preventative care, making sure that any illnesses you have are well monitored and well managed, making sure that when you need a referral to a specialist or you need to be sent to for specialists to look into something a little more deeply, they're there overseeing that process and helping to communicate those results with you and kind of walking with you through your healthcare journey. You've probably heard through our premier and through the Jane Philpott Primary Care Access Team how much there's importance in primary care and making sure that everybody has access to primary care. There's a really ambitious call to action saying that our goal is to make sure that every person in Ontario has a primary care provider. But we're here for the challenge, and we're going to do the best we can to help stand up to that challenge. They've given us till 2029 to make sure everybody has access to a doctor or a nurse practitioner or a primary care clinic. Yeah, it's I'm very excited about it. I'm so happy that there's legislation to back this, and I'm happy that there's such a focus on primary care because we know it really is the core of our healthcare system. A piece that we really need to step up in Northumberland County is physician recruitment. So we've lost several physicians over the last few years through retirements. A few have left the county, mostly through retirements. We know we're looking into a future where we have a few more that are going to be retiring. And we need to do really well at recruiting and bringing in backfill for those physicians as they need. And the OHG spent a long time figuring out what is the best way, what's the smartest way to use our resources efficiently and effectively to recruit more doctors. We came up with a plan in collaboration with our partners. The county stepped in and said, hey, we want to do this physician recruitment. We said, if you want to do it, that's fine. We would like to be on that advisory panel. And they said yes, so that's wonderful. We know that the county has now hired a physician recruiter and they've started already. Paula is her name. I think she's going to be really excellent. And we have 4 members of our Ontario Health Team of Northumberland that are sitting on that advisory committee, which is great. And now we want to see them get moving and start bringing some family doctors into Northumberland County to fill some of these positions. And I'll hand it over to Dr. Fraser Cameron, who is graciously here on, I think it's one of his clinic days. He's virtually, but to speak and share his thoughts.
I am here. I might be getting video.
He's
No.
talking.
Can you hear me? No.
To speak and share his thoughts.
I'm trying to, can you hear me at all?
A little delayed with that.
Can you hear me now? How about now?
Oh, absolutely.
Awesome, yeah, I figure I'll give you a little excitement when I see our.
Can you hear me? Anyone?
This library system actually has book club and a book bag, set of J.D. Philpott books. So that has, and members of council have an opportunity.
I just did that.
to look at books. So we're really eager on, within our municipality, to be supportive. I know in our first term, we did our letter of recommendation to support the OHT for the application for the nurse practitioners. And, you know, obviously we want to know as soon as there's any opportunities, but is there anything outside of grant applications that we could be doing to support the work of the OHT?
Oh, that's lovely to hear. Thank you so much. Definitely sharing awareness to the community of our website and those navigation supports so that we can really help people find the right services when they need them. We're building a primary care access and attachment initiative, which is going to be kind of the next level of that rural outreach clinic. We're working with all of our partners across the county, and it would be great to come back and speak with you all again once we have some more direction with that and talk about what that looks like, and would love your support with that.
I'm going to speak of my hometown, Grafton. A few years ago, a pharmacist moved into there, and since then, which we didn't have any coverage at all before, but since then they hired a nurse practitioner, I believe, as well as they have a doctor there 2 to 3 times a week, maybe 3 or 4 times a week. I'm not sure, but he's doing a lot of work there, and I think that's helping him. So is that part of your goals and everything else as well?
Our real goal is access and attachment. Those things like walk-in clinics kind of patch up gaps in the system, but really our true goal is that everyone has access to their own family physician or nurse practitioner that you are connected with, that walks with you through that longitudinal health journey of your life. But helping people to know where there are walk-in clinics is part of our work too, and we have a page on our website to help direct people towards that, because instead of going to Emerge or instead of not going to get help, walk-in clinics are an important part of the system.
And I have a little easy one to take it back.
Yeah.
I had, some illnesses or whatever, and gone to not the university, but to the family, well, it wasn't university, but at least to the pharmacy there, and got some service.
Yeah.
And then my doctor complained about 3 weeks later, he got a bill for $30 because he wasn't, I guess because he wasn't available to look after me when I needed it. But to me, that's just so wrong thinking, because I'm trying to stay in the emergency, I'm trying to get help or get myself looked after quick, and it just doesn't make sense for me to take that $30.
I would love to hear Dr. Cameron speak to that, although I could also, but there's no better expert than
Dr. Cameron on now?
I am here. Can you hear me?
Yes. Good morning. Thank you.
Oh, perfect. And while I was fixing my audio issues, I may have missed the last question.
You may have missed a lot. Well, we were talking about the $30 fee that the doctors have to pay if one of their patients goes to a
yes,
clinic or something like that. And we'd like to discuss that a little bit more and see what your thoughts are on that.
So that practice is called negating. It is meant as a way to prevent doctors from taking on too many patients that they can't possibly care for. I believe that is likely going to be taken out of the system in the next, because it's taken from something called an access bonus. So doctors are paid a bonus if they have availability to see patients urgently, and you lose that bonus for every patient that goes to someone else. So as part of the changes that are coming through OHIP, I believe that that part is going to be removed. So that might not be part of the system for very much longer.
Thank you, that's great news. Would you please go ahead and continue on your presentation?
So my part is basically to say that when it comes to physician recruitment, our county for many years was hanging on, but in the last few years we've fallen behind with not having an active recruiter locally for quite some time. That's become acutely, I would say, desperate. We are through fits and starts being able to get the odd doctor in to replace retirement, but we've had several practices go dark over the last 2 years, and we're at risk of having several more do that as well. And so there is great urgency for a recruiter to be hired, and making it a county-wide solution would mean that we have a full-time recruiter looking at the needs of the full county, and it's their number one full-time priority. And it would greatly professionalize the system that we have in place. And hopefully, from our very low floor at present, which is currently no recruiter in our area, there is a recruiter up in Trent Hills. But with having our low floor of having nothing locally in Cobourg and Port Hope, the proposed solution would be a massive improvement, and it is desperately needed.
Thank you. Go ahead, do you have anything else, or?
That was it. I welcome any questions or any feedback or feed forward or.
Members of council, do you have any questions or comments? Go ahead, Councilor Angel.
Through you, Mayor. So a question to Andrea, a couple actually. The funding for this, is it still gonna be part of the levy from the township, or is it gonna be based off the county levy? And the success rate of this for physician recruitment for Northumberland and maybe versus some of the other municipalities throughout that 58 different committees that are going on to do this?
Great questions. I think the county could speak to what the cost is, and I think they've disclosed what they're using from the income that they have in the county to hire this physician recruiter, and it's not inexpensive to get a really skillful physician recruiter, but it's a really important investment. In terms of how we're doing in Northumberland County compared to other Ontario health teams, we're not the worst across Ontario. Definitely. There are some quite remote populations that are really, really struggling with physician recruitment. But we definitely are looking into a scary future if we don't get much better at replacing the doctors. And there, as Dr. Cameron mentioned, there are vacant practices where patients are orphaned because providers have left. And those need to be, the priority needs to be filled. And to clarify, what we're talking about is primary care physicians. So it's not the specialists that work in hospitals, although some of our family doctors also work in the acute care system as well. It is that family doctor, family nurse practitioner that works in the community that oversees your primary care.
And I just respond real quickly, because I've been on that board for a little while. It's not something, it is the doctor that we gotta encourage to come and everything else, but it's even as much or almost as much is the spouse and the kids, and you have to be able to encourage them to come, because if the wife don't wanna come, here you go.
And do you need a recruiter who can do that?
Yes.
Those conversations, who, like pitches the woo.
Yeah.
And it's not just about money for these family doctors. It's not just about whether or not we can offer the biggest incentive. Sometimes it is that we offer things like an accountant has offered their time for 2 years to support this provider as they set up their clinic. Or a boat slip has been offered to somebody who's it's hard to get a vote slip, and that helps to incentivize doctors and their families to come.
Deputy Mayor, you have a comment?
I did have a comment. When I'm listening to the physician recruitment strategy, it's my understanding that doctors coming in want to be part of a team. And my doctors are a part of a team. Is that what this group, their strategy is to offer teams that they can slip into, I'm not sure the name of my group, but they have been bringing in resident doctors. They're not wanting, I don't want to say target, but the recruiter wouldn't be targeting a single doctor. Is it, and what are the strategies that the recruiter is looking for to make it the most comfortable for, especially a new doctor coming in, where they can pick the brains of the other doctors? So I'm wondering if the strategy, I'm sure the strategy is in place that would look after all those thoughts. Is that correct?
So I think the priority is to backfill or to replace the many physicians that have left. And it's probably something like 10 plus from Brighton over to Port Hope, north to Trent Hills. So I think the priority is to replace those vacancies that are within family health organizations and family health teams.
Yeah.
When it comes to team-based care, the current thinking is that really the best way to practice primary care is within a team. I think Dr. Cameron, you could probably speak to the importance of team-based care.
I think it's not available to all of us. So I practice with a group of physicians, but not with a group of other primary care practitioners. So I don't have access to nurses or physiotherapists. That's present in only what's called a family health team. And about half of our area has access to that. And so I would love for that to be expanded, but that's not currently an option that's available to us. And that depends on the province. But we are always open to trying expanding that and making that more available to all physicians. But really the priority for the recruiter is to replace who we lose and make sure that we have a steady supply to take those spots that come up. And expanding team-based care is a goal, and we have tried, but ultimately that's not is not ultimately up to us.
Arnold?
You have a follow-up?
I do have a follow-up, and it has to do with your situation and when your doctor gave you the dickens for going to a walking clinic. Is it something that we could do here? And this is to you, Dr. Cameron. Do you believe that's being rectified where the people aren't getting penalized for going into walking clinics? Because I know that's the scare around here. People will say, well, my doctor has said if you do it again, we're not going to see you anymore. So they're sitting in the emerge. So is it close that the government is going to appeal that and not make that necessary?
It's something that they're calling Faux Plus, and that they unveiled it in the early part of the summer. And so it's currently in negotiation with the OMA about whether that's going to come to fruition. So it is a proposed change that would be eliminated. I think that it's a really difficult one because it's supposed to be an incentive for doctors to have availability, but then some doctors use it as a cudgel to prevent doctors or patients seeking timely care that's not being offered to them. So it's a really difficult trap that the previous system created. And I don't think it is fair to fire someone to go to a walk-in clinic if they don't have the option of seeing their doctor. If they do and they have timely access, well, yeah, of course, they should see their doctor. But if they don't, then that's a different story. And I don't think that's right. I agree with that.
Well, Mary Lou, just a follow-up. Would it be a good idea for us here to write a letter to that agency requesting that be repealed?
I think at this time it's something that they're aware of and looking at removing from the current agreement.
Okay,
But
thank you.
I can't tell you how certain it's going to be or when it's going to happen, because I know in my experience, our agreements tend to be retroactive and from quite a few years ago. So it might not be a few years for it to come through, but it has been proposed.
Thank you.
Thank you,
Thanks
Dr.
very
Cameron. Any other members of council with a question or comment? I have one more comment. Councillor O'Neill has been on the physician recruitment for some time, and she's moved on to something that I think a little bit more closer to her heart. But,
Getting in trouble.
and Councillor Booth, I'm not sure, but Councillor Booth has accepted the appointment to your board as well. So I don't know if you're going to be a committee meeting yet or not, but
And this is the county's led physician recruitment?
Yes.
Advisory. Okay, excellent. And Councillor, you were were you with Trent Hills?
No, I was on the West Northumberland.
That's why you're familiar to me.
Yes, and Andrea wasn't a voting member of the West Northumberland, but she was a resource. She came to the meetings and gave us information.
okay, Dr. Cameron and Andrea, I'd like to thank you both very much for coming and presenting today. I certainly have a better understanding of the team, and we appreciate your help, and if you leave your card, we'll be able to contact you.
Great, thank you very much.
Thank you.
Thank you.
Last observation, we do indeed have patients who are Trent Hills and West Northumberland, so we are the municipality that wears two hats on this file, so.
Okay, good to know.
Thank you very much.
Thank you.
I'll leave you with resolution. It is recommended that the committee of the whole receive a presentation from Andrea Grove, executive lead for the Ontario Health Team of Northumberland, and Dr. Cameron regarding physician recruitment in Northumberland for information. Mover and a seconder. Moved by Deputy Mayor Stoltenberg, seconded by Councilor Booth. Any further discussion? All in favor? Motion carried. We're going to move on to committee reports. 6.1, a motion to receive the committee reports. That agenda item 6.2 to 6.6 on the September 16th, 2025 committee of the whole meeting agenda be received for information. And that will include 14, I believe it was, from the library, 6.3 from the Lower Trent, and 6.4 the parks. 6.2, 6.6, 6.4, 6.5, and 6.6. So I'll ask that we approve them, and if you want to hold anything back, just say so now. If you want to discuss any one of them, you can do that now. Deputy Mayor?
I would like to speak about the library board minutes.
Okay.
And
We're gonna pass the ones that we don't want to talk about
Okay.
specifically, and then we'll come back. So anybody else want to, other than one not move? Yes, go ahead and Catherine.
I think we would need to talk about the recreation recommendations that are sitting in front of us. And also we need to make a recommendation on 6.6. The position recruitment.
Okay. So if anybody else that anything want to go? Yes, go ahead.
I guess we're pulling them all, but I just had a question about the OPP board minutes.
Okay.
Thank you.
Anybody else that anything want to go? So I see that as we're going to pass all at once, 6.3, and that's it. I think everybody else, all the rest were full. Go ahead.
Do we not pass them all for information first and then deal
Yes,
with
we
it?
can do that if there's a recommendation after that, yes. But we're going to talk specifically about the other ones. Okay, so I'll read the rest of the resolution. That the agenda, item 6.2 to 6.6 on the September 16th, 2025 committee of the whole meeting agenda be received for information. Mover and second. Moved by Deputy Mayor Stover, second by Councilor Booth. All in favor? That's carried. Okay, Deputy Mayor Stover, we wanted to talk specifically about 6.2.
6.2, and it is the grouping of the library board minutes. And if I may, Mayor Lobo, I would like to ask Councillor Booth if he received any information on the closed meetings, if those would be included or more in depth on. I understand it's closed meetings, but procedurally updated. Thank you.
Through you, Your Worship, we had a library board meeting last night, and we made sure that we were following all the rules for closed meetings now, which is going in and out of it and everything, that was all done properly.
Thank you, Councilor Booth.
Mayor Logo.
Yes, you have a follow.
Yes, it has to do with the meetings from 2024 where they weren't followed. That procedure wasn't followed.
Thank you.
So I'm not sure what the question is then.
Will, through your Mayor Logo to Councillor Booth, will the minutes be corrected?
I don't know how we can go back to 2024 if, I think the issue was is when we were going into close and coming out of close to make sure that there was a mover and a seconder and things like that. So we can't go back a year from now and try and correct something that wasn't done at that time. I do know now they know the exact way to do it, that somebody has to make a motion to go into close and then they come out, and that was done last night flawlessly, no problem.
So that would,
I think it's a reasonable request that Deputy Mayor Stover has asked, and we should take it back to the board. And if they can do something, then they can do something. If they can't, then
Well, I can answer that right now. What can they do about something that happened a year ago?
I don't know. But if you ask the board, maybe they.
I'll take it back and ask them, but I can pretty well tell you now, my opinion is, I don't know how you can go back to a meeting in March 2024, and if they didn't have a mover or a seconder to go in or out of close.
Just take it back to the board, please.
and just one more meeting. It's the March 7th meeting, and I'm looking at that meeting, and it doesn't say who attended, and this meeting was not a Zoom meeting. So I'd ask that that be corrected as well, please.
Is that the March 10th meeting?
Oh, it's March 7th,
Is this 2024?
2024, right.
Okay, I will talk to the board chairperson and ask them to look into that.
Thank you, Councilor Booth.
Thank you. And I don't know if you want to go on to my next, or let's see if anybody else has any more with the library board.
I just want to make a note from the library as well, that appreciate all the minutes and everything else. They should be signed before they come to council, or I have to do, and they're not being signed by, some of them are not being signed by the chair or the executive director. Okay, there was nothing on 6.3. Let's go to item 6.4. Who wanted to hold that? Councilor Ainsworth, go ahead.
One second. Yes, committee, the Nuwak Sanctuary, there's the subcommittee group, we did a walkthrough through the area, and we come up with multiple things that we would like to, get council's direction of maybe what could be done, and maybe see what the process would be in that. Now, if everybody's had a chance to look at them, the biggest one is the main bridge that crosses the outlet of the pond. And I know there was an engineering study done on that, and to me, I think there's probably a very simple fix for that bridge. We'd like to keep that bridge and literally just fix the rails that are underneath the bridge that they sit on for the steel girders. So it'd be nice to have someone come in and just look at, see if we can fix that bridge. The other bridges, just need to be, set up and leveled again. They all seem to be in fairly decent shape. They're just, sinking into the ground. So the supports underneath them. The other thing is invasive species, that are there, and just, general continual tidiness of keeping the grass cut, keeping the trails trimmed back, spraying for, whether it's poison ivy or anything, that people could get while they're walking through there. The subcommittee was looking for direction to see, the money that was set aside from the lot that was sold down in Grafton, it was set in. And, can that money be used to facilitate some of these fixes in the Watton Sanctuary? And where our next steps are to go through days with our committee.
From this council, so here we have the study, the group who has given us a very clear set of recommendations, and we do need to move forward as a high priority. Can I speak to, yeah, so should we deal with each recommendation then? So I move that recommendation 1, that we council direct staff to consider the recommendations contained within the report budget during 2026, budget deliberations. So I would move that we make that motion. Recommendation number 1, I make it as a motion that we move forward with that.
Okay, the recommendation is that,
Okay,
report from the Northumberland Sanctuary Working Group during the 2026 budget.
Correct.
Okay,
No, it's
so I don't know why, can we not take them all at once? I don't know. Are we gonna start saying we want something, we don't want something?
I think it's worthwhile. Like, if I was staff, I wouldn't want 4 motions essentially coming forward in one motion, but
All right.
if
So
they
you
want it,
move her.
I'm open to it being one motion.
Oh, let's go ahead. You moved it, you seconded it. Any further discussion on item 1? All in favor? That's carried. Recommendation number 2 is recommended the council direct staff to monitor usage, visitor numbers for Sandy Bay Parkette, and install picnic tables, benches, and trees. Go ahead, Mary Donovan.
This one came up a little bit in discussion at the meeting, and I wasn't there for the full meeting. But government speed can be a
She's got it on the first. So you can move her seconded.
okay, and then I'll move it.
All right. Mike, you're going to second? Go ahead, Mary Donovan.
Just that this recommendation is coming to us now in mid-September. It will be approved at our meeting at the end of September. This recommendation was made in mid-July. Whether we get a picnic table in there after tomorrow's or next week's meeting is a little bit moot, because it would have been good if the picnic table could have been put in right away. So this is more of a logistics observation, that this recommendation will now have to wait for next year, even though it would have been ideal if it could have been acted on directly from the meeting. So I'm not sure even that this is an appropriate direction from council at all, given that this is just information from the eyes and ears of the community to our staff. But I think it came this way primarily because our recreation manager was not at the meeting, so they were wanting to send a message to staff who wasn't at the meeting. But anyway, I agree with the concept here of learning more about Sandy Bay and making sure it's in good, has picnic tables and new trees and all of these things. But I don't think this is the best way to deal with this.
Anybody else have any comments? Go ahead, Deputy Mayor.
Through you, Mayor Lobo, I'm wondering, was this a budget item? Is anyone know? It will be, so it isn't? Okay, so would it be to recommend that it be looked at in the 2026 budget?
Would make sense to me, does that, go ahead, we got it?
Sorry, recommendation 3 is the budget, but recommendation 2 is just part of regular maintenance of our parks. That would be a
Oh, I
special
had
budget
some-
line.
Okay.
And I'm not just exactly sure how staff is being directed to monitor usage of visitors' numbers.
Yeah.
Do we have any way of control? Are we taking, I guess we could take surveys or something, or people sign off when they come in, or something. We're not gonna send somebody up there to monitor and see how fast or how many people come in. Go ahead, Mike, you've got an answer.
Through you, Mayor. Well, we had some suggestions at the meeting that, maybe we could bring in some school kids that are looking for their 40 hours to do something like that. And just throwing some stuff on the table. And maybe even some volunteer work to find out those kind of things along with, the same idea with recommendation 4.
Yeah, okay. I
Just
was
my
going to say
idea.
perhaps there should be more specific when you put these, and mention that on the recommendation.
Yeah.
Mayor Lobo, if I may too, that it would be, I would be interested on how this could be done, the monitoring through our manager, if he would have some ideas.
Well, should we go on that?
Yeah. Mhm.
I agree.
Thank you.
And I'm not sure what you meant by number 3. Go ahead and got it.
Since we're discussing number 2, even though what it says there, I think it would be nice if we added something to it in the effect that we look for ways through the terms of reference to have these kinds of items go directly to staff or something like that. And this may not have arisen, as I say, if Jeremy had been at the meeting, that would have been a different dynamic, but we had a committee talking without the person who would be doing these things there, so I think that has contributed to this.
Mayor Lobo.
Yes.
Thank you. As I'm listening to this, our manager did bring forth adopt a park, and I'm not sure if the Sandy Bay Parkette had been adopted by an organization or a group, so that's another thought as well. Thank you.
Good point. A really good point. I think until we change some procedures, that any recommendations coming from this group or any other group have to come to council before we can say, okay, you can go ahead and go ahead, unless we put a limit of saying $200 or something like that, that they can go ahead and spend on their own. I know and I make any input from staff before I go any further, but that's what the recommendations are from this group to recommendations. It's really not a direct council. We almost need that in somebody who's directing council, but it's not. They're asking for council to direct staff, not to. It's a recommendation of council direct staff. They shouldn't be recommending us to direct staff. I think that's not the responsibility. Okay. So we've done 1, 2, and 3.
We've got number 2 on the floor right now, and it's whether we want to say this or whether it's just part of maintenance. And this was part of my discussion yesterday, because I actually think I didn't want to be able to discuss recommendation 2, but I think it should be part of an ongoing maintenance. And to your point of the adopted park, that did come up again at the meeting, but again, without the manager there, this is their mechanism of trying to get a message through. And I don't think it's the most effective way. But it, as the mayor rightly points out, it's what we've got at the moment.
I'm gonna move along. Recommendation 2, it is recommended council direct staff to monitor usage numbers for Sandy Bay Parkette and install picnic tables, benches, and trees, and consider the 2026 budget, is what I think it should be.
Sounds good.
All in favor? That's carried. Recommendation 3 is recommended council direct staff to monitor usage of Sandy Bay boat launch and return volume and minimum standard requirements by October 1st, 2025, prior to any additional expenditures. I guess we're gonna have to, again, monitor, and what's the minimum standard requirement? I'm not sure what that question is asking. Go ahead, Mike.
Through you, Mayor. I think what we're looking for there is a, you know, this boat launch, as all our other boat launches are pretty rustic. And whether there's, you know, minimum standards for that, whether, you know, the dock, the ramp, that kind of stuff. I think that's what we're mostly leaning into with that, other than, you know, same ideas of the grass, picnic tables, garbage cans.
Okay, well, that's additional questions of minimum standards for dock. I guess I don't know.
Yeah, it was just making sure whatever was done there was done according to whatever the rules and regulations are, it's all that's getting to.
I'll read the resolution first. It is recommended council direct staff to monitor usage of Sandy Bay boat launch to determine volume and the minimum standard requirements by October 1st, 2025, prior to the additional expenditures. Moved by Deputy Mayor Stover, seconded by Councilor Ainsworth. Go ahead.
I wonder if we could add, where possible, if this would assist, is the way this is worded. I mean, we know our staff are stretched, so if we do want them to be out there monitoring the usage.
Is there any reason why it was October 1st?
Yes, there was. They were hoping that there'd be some information in front of either the committee and or council to help guide what recommendation to make for budget. So that was just a date that was picked in July. It was 2 months, 3 months, whatever out. They'd be, okay, that's a good date because then we'll have that information to help guide the budget. It's not reasonable at this point, but I do think it is information that would be good to have to guide budget.
Okay, so we'll switch that to, so that the information is there prior to budget discussions in 2026 budget. We make that adjustment. Amendment to. Would you,
I would do the amendment.
are you okay with that amendment? Yeah. And for further discussion on this one? All in favor? That's carried. Recommendation 4 is recommended that council direct staff to hold a public meeting in 2025 at the Pinella Community Center to discuss the future of the building, including repurposing or decommissioning, and that local residents and user groups be notified. Mover and a seconder. Moved by Councilor Ainsworth, seconded by Councilor O'Neill. Councilor Ainsworth, go ahead.
Thank you, Mayor. So this center here brings up multiple conversations, and we know through past budgets that this center needs a lot of work, and especially for handicap entrance and exit stuff. So, and the other thing too is there's you know, so we talked about repurposing and, you know, and we talked about there's three community centers like right there within a kilometer and a half of each other. And so this center here brought up, like say, multiple discussions, and that's why we think it's appropriate now to have a public meeting with that one to decide what we want to do before. I think, we as a township puts, I don't know how many thousands of dollars, but I know there was some fairly hefty cost from our last couple of budgets to fix the roof, to fix the chimney, and all this other stuff that has to go with it. And it's probably our lowest used community center. So it brings up multiple conversations that need to be had, and maybe some of them aren't going to be very popular, but it needs to be talked about. What we want to do with the center, so that's kind of adjust for that. Whether we repurpose it, sell it, or rent it out to somebody or.
Well, that's a good point, Mike, and I think before we get into too much details, you brought a lot of good stuff up, like how often is it used, how much money is we spending, who's going to use it in the future, those type of things. And I think we gotta probably give a little bit more direction to staff and saying, that's the type of information that, or whatever they think, information that we need to have such a public meeting as that.
Yeah.
And then we can go for it. And Scott, do you have any thoughts or comments on that? Go ahead.
Through your Mayor Local, when I'm listening to the conversation and when I look at the recommendation, it is going to be a tough conversation because everyone is quite tied into their community centers. Is there any way of encompassing this further rather than piecemealing this community center, piecemealing that one, piecemealing this one? Is there a way of encompassing them all? And I guess I would look towards our CAO maybe for some direction there on that, what that could look like.
I think there is one in the strategic budget or strategic plan that I'm aware of, and there could be more.
To your point, our guiding document is our Parks Master Plan, and this is lifted directly from that Parks Master Plan. This was a discussion that was happening. I can think of it, that discussion happening as early as 2014 for sure. It came in 2018 in the Parks Master Plan. It came in our first year when we decided that we wouldn't pay for the roof because of the expense of that. When we didn't know what our future was, it will be a difficult discussion. Always it will be a difficult discussion. And sometimes, for sure, there's going to be both celebration because that facility has been such a social heart for that community. But, sometimes times change, and the word repurposing comes from members of that community. So I think they understand that this is a difficult time, and we surely will need to celebrate. And if and there's already some grieving going on because it isn't the facility that it used to be, and it's not the heart of the community that it was. So this is not the beginning of this conversation. It's just the unpleasant but necessary step.
Anybody else have any comments? I think we have to move forward. I think that this group has recommended that we look at Fenella first. And I think we should go ahead and have that public meeting. So can we be a little bit more specific than before the end of the year? Go ahead.
I think this is to staff at this point. I think giving it to them quite open-ended, especially since it is in our strat plan on top of our Parks Master Plan. I have great faith that our staff will look at this and think about what would be involved in holding this, what kind of information, and I have confidence that they will bring us what we need.
Any further comments? Good. Okay, I'll read it. You've already got to move in a second. All in favor? The motion is carried. So that 6.5, we had a question on 6.5, Deputy Mayor.
Was that the OPP?
Yep.
I know when, at 3 year ago, when I attended the, I don't know if it was the June OPP meeting for you or July, forgive me, it was a long time ago. Was it July? And then when I was reading the minutes that are in this COW, I wondered if there had been any more discussion on the municipalities being given the stats. That was a hot topic. In this, it was a hot topic when I attended for you. So I'm just looking for some information from you. Thank you.
Thank you for the question. We are very fortunate to have a chief like Chief Kavanaugh on board and leading us, because he on his own is doing it, and I don't want to. He was not 100% supported by OPP in general at the head office, but he did give us all that information, and you will see it broken down. You're not going to receive all the information. You're going to receive information from all of Northumberland County and the prospective AH material, all the AH material. So you may not see Colburn or Grammy, but you will get all of the AH material broken down.
Thank you.
And what's the, anybody asked for 6.6 position improvement? Okay, go ahead and Catherine.
So the minutes sit there in front of you, and the board had its final meeting and dispersed of all the items that was within the purview of the board to do so. And then I am going through you to our clerk for the next step on this, because I believe, because each of the member municipalities were the signatories or people who commissioned the setting up of the board, we need to say that decommission, whatever the word is. And I do want to apologize to the clerk, because I'm springing this on her. So maybe I'm just flagging this at this point and not expecting anything to happen.
Your CAO, or clerk, please, Madam Clerk, please, follow your answer.
So through Mr. Mayor, the next steps, we are still waiting for information from the town of Coburg clerk, who has been facilitating and coordinating this entire process. So he will be sending a resolution to council sometime. So he'll be sending more information to us to then bring forward at that time in terms of next steps.
Thank you.
Thank you, Madam Clerk. So this one has been received for information, so I believe we've done all of the communications. And we're going to move on to development service reports, and the first one is a notice of motion, reconsideration of denied severances and building applications, and that's submitted by Mike. Councilor Ainsworth. I'm going to read the resolution to you on the board, whereas recent legislation changes, including Bill 23, Bill 15, Bill 5, and Bill 17, and the provincial policy statement, PPS, are actively reshaping the regulatory landscape in an effort to streamline housing developments and reduce administrative barriers, and where the current township official plan is outdated, and whereas the township needs to increase the tax base to continue to fund services and programs, and whereas severances and building permits required to be turned down by staff despite council being final authority on planning matters. It is recommended that the council direct staff to bring forward a comprehensive report listing all denied severances and building permit inquiries and applications within the last 12 months to be reconsidered by council at no cost to the application until the application is successful. And then the staff explore opportunities to establish a more integrated decision-making process between council and the planning department to better align outcomes with provincial housing objectives. But I'm going to move in a second. Moved by Councilor Ainsworth, then a second by Councilor Booth. Go ahead, Councilor Ainsworth.
Thank you to you, Mayor. So I have a lot of stuff to read, but I probably don't have time to read it all. So I just want to try to highlight some of the things that's, some of the changes for Bill 5, 23, and 17, and some of the progressive planning statement. But, basically, so for instance, for Bill 5, accelerated approvals and reducing red tape, special economic zones at the, which is still a little bit of a gray area, but the province can pick a special economic zone, and then that kind of speed lines the approvals and stuff for that zone, and it could be anything. There isn't really a criteria of what is picked out. It could be another subdivision that we want to do somewhere, right? That they could use and introduce the one project and the one process. So, we talk about these kinds of things with the initiative that Councillor O'Neill is sitting on with the Affordable Housing Task Force. And all that aligns with a lot of this stuff that the province is doing. And actually, when I took all this stuff to our David Piccini's office, he was surprised that the information that I gave him through the task force that actually aligns with the stuff that the province is doing. So it just kind of goes along. Standardizing more predictable development charges framework, and the consistent and streamlined planning standards. So same kind of thing that the task force is asking for. One set of rules for every municipality instead of contractors coming in and having to deal with a whole new framework. The infrastructure and housing delivery support, so that's again with the special economic zones. Faster transit, housing and municipal infrastructure rollouts, and also in all these bills, they're really putting the power into the municipal's hands and taking it away from upper tier. So the province is also committed to 400 million in support of municipal infrastructure through it all. The Environmental and Heritage Review Act was part of Bill 5, and and also these the agricultural assessment requirements may be waived in these special economic zones. So another step that could be done. So the bottom line for the municipalities is a speedier, more predictable approval environment, access to reformed development charge regimes, harmonized building and planning standards, and enhanced provincial funding and support through the economic zones. So for Bill 17 was, again, the development charges was part of that process, and streamlining that and putting it back onto when occupancy is put forth. I'm not sure in the gray area whether that's just for contractors or also for landowners. And the development charge is also stuff that we talked about. How do we dip into our development funds charges? But that's also partially addressed in this Bill 17. So something that maybe staff could dig into. Merging the development charges across the whole services and categories, standardizing capital cost definitions. So, like I say, the list goes on and on of what comes out. So just kind of a benefits at a glance would be cash flow for revenue, more predictable revenue timing, reduced immediate financial burdens on developers, planning and efficiency, fast application processes, streamlined requirements, fewer disputed studies, and approval simplicity, less less reliance on minor variance and municipal committees for minor changes in design standards, uniform building codes across municipalities, reduce design revenues and approvals of complexity and infrastructure growth, so faster coordinations and delivery on transit oriented. So, I want to find, so Bill 23 was the, More Houses Built Faster Act. So initiatives in housing growth and flexibility. So municipalities can now permit up to 3 residential units on the same single family lots. And so the addition of units for exempt from the development charges like parklands, dedication requirements and community benefits and charges. The reduction in fees for rentals and affordable housing. So you get a 25% discount for a 3-bedroom, you get a 20% discount for a 2-bedroom, you get a 50% discount for a 1-bedroom in affordable housing, which again helps and aligns with some of the things that we talked about. And more predictable development charges, again, they talk about, and streamline approvals for small scale residential developments. So, one set of rules fits here, whether it fits in Brighton, Hamilton Township, the town of Cobourg. We all have a set of standards, and that's what it's all about. And that's why it's important for us to try to get our official plan in order. Maybe some of the things that have been turned down because we're using old language. And that's why I truly would like to just, as a group, work with our plan and work with staff and try to bring some of these new things into light and try to increase our tax base so that we can put together and keep our services running like the motion says. So for 23, so increasing housing flexibility, more units permitted, lots without rezoning, fee reductions, lower waiver charges for rentals and affordable housing, review on predictability, so cap development charge rates and longer bylaw terms, streamline approval, so fewer planning hurdles for small projects, and provincial alignment as clear growth targets backed by funding and oversight. So like I say, so with Bill 23, I'm just going to move over again, this because it's taking a bit of time, but at a just lesser lot creation rules, so they want more rural residential areas increased, and there's some on prime agricultural land. So if a farmer buys a couple of a farm and he amalgamates the two of them, there's avenues for him to sell off properties when they amalgamate those two properties, which it wasn't before. Not all of it, but some of it along when they amalgamate the two. Secondary dwellings on rural lots allow more than the residential unit, up to 3 on a single lot. Garden suites and stuff, coach houses and other additional dwelling units, expanded services, policies in agricultural areas. So severance and surplus farm dwellings is what I just talked about. Reduced provincial oversight. The province has shifted more decision-making power to the municipalities, kind of things that we talked about before. Municipalities can now interpret policies more flexibility for accommodated local housing needs, which could support more lot creation or consistent with local planning. And no mandatory density targets outside of urban areas. So that's kind of my little presentation on the changes of those 3 or 4 policies that we should adopt onto our official plan, and we should be in charge of our destination with our own township. So something that I've always talked about, and so all these changes, that's why I say we're behind, and it'd be a good opportunity for with the housing task force coming up, the same ideas that actually the province has implemented. So thanks.
Thank you. Go ahead.
Through you, Your Worship. So I just need some clarification from Councillor Mike. It says it's recommended that Council direct staff to bring forward a comprehensive report listing all denied severances. So would that include denied severances that have already come to Council and we've turned them down?
I would say yes.
And it says building permit inquiries and applications from within the last 12 months to be reconsidered. So I guess clarification on that is that means if somebody phoned the building department or the planning department and they told them just over the phone, it's a no-go, I don't know how you track that or how staff goes back to, that's a long time, 12 months to go back to say I talked to 50 people or maybe it's less or more or whatever. I just don't know how we get staff to do that unless there was some kind of formal paperwork or something, so.
Yeah, I would agree with you. I think they're, look into the process of how we can dig that information back up and see.
I believe, I was talking to the planning department the other day, and don't quote me on it, but I think they had 345 inquiries so far this year. Which surprised me, that's an awful lot.
Yeah, that's a lot.
Well, then, you're not,
Through you, Mayor Lobo. So when I'm listening to this motion of Councillor Ainsworth, a couple of things that Councillor Ainsworth brought forward. Number one was additional lots on agricultural land. And Premier Ford retracted on that and didn't go forward on that because we did have a severance that we did grant on agricultural land, and I do believe we didn't get blacklisted, but I do believe we got our hands slapped. So it's kind of like listening to these bills here that you quote. And the other thing that we really have to be concerned with is the Oak Ridges Moraine that takes in excess of 50%, maybe not quite, it used to be 57, I don't know if it's 48 now. But that has its own set of rules and regulations. So I really kind of have a little bit, one of the highlights of this motion, and that has to do with how all the planners in Northumberland County are coming together and trying to streamline this, which is the benefit, a bonus. So just a little bit, the language in here, why, if there's 385 denied severances or building permits or whatever, how logistically is that to get a report down on that? And is it even something we should be asking for? Thank you.
just to clarify, I didn't see.
I added something else.
Your comment?
I am struggling with this in front of me, and Councillor Ainsworth, you referenced several times about the work of our housing task force. And it is taking a very different path. It is working with our staff. It is working with our experts. It is saying, well, we want you to look in this direction. We want you to come back to us with ideas on how we can move in that direction. And I think that is a process that I can fully endorse. What I have in front of me here today, I find very challenging. It appears to me that what we're going to do is ignore all of whatever the planning and all of those documents, and we're going to allow people to come before us. And not only are we going to be in a position of directly deciding, we're going to always decide because they're going to come back to us at no cost until it is successful. That's what it says right here. In other words, you're not foreseeing us turning people down, but there are lots and lots and lots of good reasons why people need to be turned down for different reasons. I certainly concur with our deputy mayor in the concerns about agricultural land. We are a community that is our backbone. That is our number one industry. They have reached out to us on numerous occasions about protecting farmland. We're also a tourism community. We are a community that has much more than other places protected land through land trusts and a variety of different land trusts. Anyway, back to, I certainly do not think it will be appropriate for me as a counselor to be decided, I like you and you get a severance, and I don't like you and you don't get a severance, or any kind of nonsense like that. I want people to have a process. I want the professionals to assist them in the process. I do not think this is the spot I should be as a counselor.
Thank you.
Mayor Logan,
Yes, go ahead.
I wonder if Councillor Ainsworth would agree to an amendment. Would you like to hear the amendment first?
Go ahead.
Yeah, through you, Mayor. I'd like to answer a few questions first.
Okay.
So this isn't about who your friend is. This is about going by provincial policy.
Yeah.
Right here. All this stuff that I read, I didn't make it in. This is provincial policy that I took my time to look up. We're not adhering to it. That's all I'm saying. So these are the rules, right? These are the rules the province is handing down through us of these bills, right? And all we have to do is follow them. We need to adapt these into our official plan, and we just need to follow them.
I'm not convinced, Councillor Ainsworth, that we are not following. You're saying we're not following them? I would suggest that these 4 policies that you brought up, that we go to the county planning people have already done a investigation and seen how they could be effective. And we can actually ask our planner to talk with the county and see if there's any difference in that. Provincial policy statement, I believe we are working on. And it was our goal to have that done in 2025. And I believe, you can correct me on this, CAO, but I believe that's what our plan is looking towards. And so that's my first couple of comments. And on the final one, I could be wrong, but I have not heard of anybody being turned down and paying the money and being turned down on an application. Have you heard of somebody like that?
Yeah.
Okay, so they paid the money.
Well, I don't think they paid the money. They come into the, whether it was our new planner or past planner, that came in and just got turned down with their, when they brought it to that office.
Okay, they got turned down because.
And the other thing too is all the changes that have been.
No, let's go back. Can you be a little bit more specific? Because I'm not aware of anybody.
Yeah, there is. I don't want to give you the names here. I don't think that's appropriate, but.
No, I'm not asking for names, but if you could tell me the application number or whatever.
I can't, yeah, this time.
I don't expect you to now.
Maybe offline, we can talk about a few of them, of the staff, but I just think that, things have changed so much in the provincial level, and they want municipalities to make the decision. Not counties, not upper tier, they want the municipalities to make the decision, and they're giving us the framework to do that.
And that's why we have to clarify what the policies are and what the changes that we could possibly do. I don't have a problem changing as long as we're going to stay within the policies.
And that's what I'm saying.
Go ahead, Councilor Booth.
I guess through your worship, I guess I have to get my head around it, because that's why I asked Mike about denied severances. So if it did come to us in council and decided, and I can't recall any of them, that I don't think it's right that these people can come back again if we follow the rules at that time. I guess my problem is we're going to go to staff, and I thought it talks about building permits too. So does that involve not just the planner, but the building department too? That are we going to go to them and ask them, Madam Planner, if we're getting 300 and something calls, how many of those do you recall were telling somebody no, that they can't do it, and how are we going to bring them back? We talk about staff being so busy and everything, just doing the day-to-day stuff, that now we're going to ask them to go back a year now to tell us how many times you recall, that you've turned somebody down. I'll use like the deputy mayor said, I know in past council, we had a few people that because they lived in the Oak Ridges Marine, were told right from the start, there's nothing we can do for you as council because that's a provincial policy and we can't override that. So I don't want to see those ones coming back because it's like nothing changes for them. Would you be open to, could we defer this and then have maybe the planner come back to us and ask if this is even plausible to happen? Because I don't think it's fair for us to tell staff, go ahead for the last year, we want to know everything, and it ends up being, as the mayor said, it could be a couple of hundred that we're gonna have to go through with that. So I don't know, or maybe it's not that many.
Whatever. Whatever. Okay.
Through you, Mayor and Council, not to be involved in your debate, but to give you some background information. When a resident comes forward to make application for zoning, for lot creation, for whatever, or somebody comes forward to apply for a building permit, they have a conversation with the building official or the planning official, and the information is given that either you do comply and will help you get this done, or you don't comply. If the person hears that they don't comply, they still have a choice. They can say, no, I want this to go to council. Our planner and our building officials then have a responsibility to help complete the application and have it go to council. It's the person's choice. So my understanding after visiting with our building official and our planning official is that we don't have a list of those that were denied or turned down because we don't keep track of those. We can only keep track of the ones that have come to council that would be on file, that would have been denied, which we would be able to get that through the planning meeting documents that came to council or the minutes. Those we would have records of, and you would have records of those as well. So that is my understanding, but if you would like more clarity from both of those official positions, then I would suggest you ask for that and come to a meeting to discuss, and they can tell you themselves what that information is. I hope that helps.
I really appreciate the comments of the CAO and the acknowledgement that we already do have a process. If one of these bills that you've referenced does change in individuals, because right now on Oak Ridges Marine, for example, I wouldn't be able to put a second dwelling on mine. If something changes and I could bring that back, there's a process for that. And from the perspective of our staff, there are processes in place. Those processes are being followed. I have confidence on it. I now remember the other was the word entitlement was used as a concern by one of our staff. And this is something that this reads as people who feel entitled to do something will be able to bring it back and harass staff to say, well, I want to do it, so therefore I get to do it. And the poor staff member who's saying, but the legislation says, is now going to be hung out to dry as they say, well, I'm just going to take that to council. We have to support our own processes. We have to support our own staff.
Mayor Logan?
Yes.
Again, I'd like to ask if I could make an amendment that would say to include, well, not include, maybe an amendment to say, continue to work with the housing task force to, what's the word I'm looking for? Generalize the process so all municipalities are working, are trying to expedite it because everyone is working from the same roof. And I'm sorry, I'm kind of struggling here. May I ask Councillor O'Neill for the wording on it, just to continue bringing that, working on that?
I would suggest we probably can't make that amendment because we've already made a motion that we have directed our planner and CAO to engage in that process already. So because we've already made a motion of that nature, the clerk could help perhaps clarify for us, but that would be my comment to it.
Is there any way of sticking it in this motion?
Madam Clerk, do you have an opinion?
Through you, Mr. Mayor, you can make an amendment at any point to add something to sort of hammer home or continuation, so you can, but it is also to Councillor O'Neill's point, it is redundant because it is already.
Okay, thank you.
Go ahead, Councillor Ainsworth.
Through you, Mayor. So, this isn't a disrespect to staff. Not at all. This is just saying that we've had so many changes come through the province in the last year and a half, and we're behind. And if we're making decisions with old language, that needs to be addressed. And okay, if people come knocking on the door to say, hey, I want a severance, and they explain where their area is, and the planning department says, no, you can't have it for, ABC reasons, those may have changed. I don't know how, if we didn't keep track of that, okay, that's probably not an issue, but how do we get back to those people? Those are tax dollars for us, so we can run our department or our township better than what we are because of being strapped with funds. So if the initiative of it all is to increase our tax base. We need to do that. Or raise our taxes. Those are the two questions that we have to ask our residents.
Yeah. I agree, we're getting way off the subject.
But I'm just saying, like this, everybody's saying that, like you sit around the table and you're talking about, I don't want to do this for my friend, or I don't want, this is not what it's talking about. This is provincial policy now.
Well,
This isn't about anything else. And this isn't about attacking staff, and it's not about attacking anybody or doing favors for anybody.
no, what we should be doing is going to our staff and asking them to give us some information on how this will affect Bill 15, Bill 19, Bill 121. Because I'm not an expert on it, and I don't know anybody else's, other than this particular profession. That's what I think we should do. Go ahead, Councilor.
Through your worship, I like what the CAO suggested is if we could ask those two staff members to come to us, and if we do keep track of at least the written ones that were denied, then maybe they could review those ones to see if policy has changed or something like that. Then I would agree on that if something has changed in the last 6 months, that we could inform those people, you know what, things have changed, you could come back. I guess, like I said, my problem is the last 12 months is going back, and as Dave said, you don't record down people's names if you just told them over the phone. So if we have some records or stuff like that, I'd like them to be able to come back to us and they can look at them and say, yeah, maybe there's a half a dozen that we could tell them that things have changed. I'd be open to that. But that's why I'm thinking, Councilor Mike, it's better to defer this for right now until staff can maybe, if they have them come make a presentation to us to say, how many do we have in the last 24 months that are recorded that we have an application was denied, and how many of them are actually changed by any of these new bills?
I know our staff, and they may or may not be 100% up to date, but I can tell you, if they come across something that has changed, they go out of their way to help that person out. I've seen that numerous times. So they don't just forget about it. If there's something they can do, they like to do. Yeah, was that a formal motion?
Well, I'd like a motion to defer this motion right now until we can have the two staff members come back to us, as the CAO suggested, to give us some more information on this and discuss, questions that we would all have.
Are you second? Second by Councilor, or Deputy Mayor Stover. We have to go back to the original. All in favor of the amended? Yes.
Can we debate this one? With the defer? Just have a few things I want to say.
Yeah.
Okay, so through you, Mayor. So if we defer this and we ask staff to come back with some information, can we also have staff come back and talk about when we're going to get on with our official plan? Because when we do our official plan, that will encompass all of this stuff that we're talking about.
Correct me if I'm wrong, but I understood that the CAO was saying that we're gonna have an official plan done by the end of this year.
To you, Mayor, no, I don't believe so. I believe that council should invite these two individuals to a meeting and you should ask these questions. The official plan, amendment to the official plan, I believe was something that could be worked on for sure. Depending on whether it was with their own staff, if they had time, or if it needed to be contracted out, I'm uncertain of that answer. But bringing both individuals in and asking them those questions would get you the answers.
And I'm pretty sure in the budget that if you need help to do that, that the great official plan is gonna do that, but I'm not up to date.
So Mayor,
Okay.
could we have, could we have some kind of path moving forward on the official plan from staff to say that we're going to start it within the next couple of months?
I think the CEO is right, we should wait till we get the proper people here at the meeting, and then we can ask that question. Go ahead, Councilor.
And it's just for deferral, Mike, it's not saying that your motion is out, it's let's not let them speak to us first, and we can ask them all those questions, as the CAO said, and then we can decide from there.
Yes.
There is a possibility if we reach out to the planning department ASAP, that we may be able to get it on the next meeting, which would be next week. To be able to ask these questions, your planner will be here.
I think that's a great idea. Okay, so we made a motion that we,
Jones seconded.
yeah, so we have someone from staff, a couple people from staff here, and we'll see if they can't be here early next week. All in favor? Opposed? Motion carried. Next, we move on to public works and infrastructure reports, and the first one is the draft municipal water system. Yes, we can. Anyone want to take the 5 minutes, 10 minutes?
10. Thank you.
7:38.
No word from, well, it'll tell how many people. Should I have called? Should I have called? That's how she sent it to me.
Okay, next on the agenda is the Grafton Municipal Water System. Stefan is here today, and I expect you're gonna have a little bit to do with that, so. Both of us.
Yeah, sure.
Go ahead, Gail.
Yeah, through you, Mayor, to council, this report comes to you as an identified deficiency with respect to creating the master water plan. The master water plan was a recommendation from Lucy probably about a year ago with respect to being more grant ready, having a plan that the water infrastructure follows. Our water model study is now complete and will be coming to council at the first council meeting in October, I believe is the date that we've agreed to. And of course, respectfully understanding the requirements for sole sourcing, but it is up to council whether they choose to do that. We remain committed to accomplish the goals and your wishes. And if council does wish us to go back and go open, understandably so, I've identified information in the report with respect to that.
Thank you for the report. Any questions or comments from council? Go ahead, Councilor Haynes.
To you, Mayor. Can you walk us through what the water master plan would look like?
Other than the information that I provided in the report, no, there's specifics in there on what it covers and what it does. How this got started was a couple of years ago, there was some grant opportunity money for bettering our water infrastructure. We know that the water plant is at maximum life, and that there needs to be some consideration with respect to replacement, etc. The township did receive a grant to dig a well. Drill a well, sorry, with respect to another well that had gone, that had to get shut down due to contamination. In understanding why we were not grant ready or had the ability to apply for grant funding to increase capacity or replace infrastructure, through a meeting with Adam Taggart when he was employed with Lucy, was that because we did not have these reports that were required, very, very similar to the Grafton area, and being able to apply for grants. So having our due diligence done in these reports completed, my understanding is that it puts us in a much better position to understand our infrastructure and to plan for the future.
Any other questions or comments? Go ahead, Nick.
I'm looking at the Grafton Communal Water study from 2021 that the previous council received. Now, how does that tie in with the current study and then with the proposal?
Could you repeat the name of the study that you're referring to?
So it's called Water Rate Study, County of Walworth, January 2021. So when I sent in that email, the link, so.
My understanding with that is that's just a rate study. That it doesn't do the same thing that a master water plan does for us. In full disclosure, I don't work in the water infrastructure, so this is the recommendation that we received from Lucy and we've been following forward on. I can only assume that the rate study from 2021 with respect to infrastructure costs today and rates that people are paying, I'm sure that it's probably related, which might seem silly to some because it's only 4 years old. However, As you know, our complete financial environment has done a backflip, so we probably need to have new rates. I'm just guessing.
Go ahead, Mayor Conlon.
Well, it is a little bit of a follow-up to that. I know when we chose to go without the committee on water, we were still going to have regular reports coming directly to council from Lucy, so perhaps it would be appropriate to have someone from Lucy come in and give us a report on our water safety, but also answering that, how things fit together.
I have a little bit of history on the water system, so I'd like to make a couple of comments. First of all, I wasn't around when Roberts did that study in 2001. I did do a previous one. And basically, he was hired to do an asset management review and see when we should be spending money and this, that, and other type thing. And he tied that within a rate review as well. And I think what he did was he went and talked to Lucy and talked to her, talked to Joe, and talked to Bill, and got the information he did to put that all together. When I looked at that study, it does start in 2021, and also during that study, we were supposed to spend, I think it was 1.3 or 1.4 million dollars in 2021 to put in the new well, and we're still working on that. Haven't got that done yet. They were also supposed to spend, I think it was 1.2 or 1.3 in 2025 to replace some of the major equipment in the pump station, which I don't believe we've spent any of that yet. And the other thing that I was looking at, it does, I'm not opposed to you bringing these people in, although I don't know if Larry's there or not. If, what was his name, Adam, if he's not there, I don't know if anybody else can do that presentation. I'm sure they can, but he was certainly the expert on it. Lost my train of thought. Yeah, and in their report too, they say that you have to do this every 5 years to update it and make sure that the figures are right, and it's all based on how many people are going to build a house within the community within every year for the next 30 years or whatever it was. And one house here, one house there makes a lot of difference. The other comment that I will make, just so everybody's aware, is that I did look at the study and I looked at some other studies that were done by, not studies, but information that I gathered from some of the other communities in the area, particularly Cranby Township and Hamilton Township. And I was surprised to see that although Hamilton Township and us are relatively the same price, there's a little bit, they charge more if the people use more water, but we charge the same price no matter how much water they use. They were trying to encourage people to use less water, and they actually have quite a bit of a difference. But when you add them all up, I think it's another $10 a month for one first year. But the other thing I found even more significant was that they have a charge of $346 for every water user. That goes to capital expenses. We don't have anything like that at all. And I know, to replace a water system, I mean, the mechanical stuff's pretty cheap. Well, not cheap, but it's not that expensive as having to replace the lines. And if you start replacing lines, you probably have to replace water, roads and everything else as well. So that's gets to be pretty expensive. Like I think it was $10 million. That was a few years back to replace the lines. So I don't have any problem bringing in Larry, but or whoever. If that's what council's decision, but I think we need to get moving on this because you can run out of a lot of things, but don't run out of good clean water. That's my 2 cents. Anybody else have any comments? Go ahead, Rick.
I actually found your comments most interesting when you said it should be reviewed at 5 years, so that would be in 2026. I think bringing this as part of 2026 budget, allowing us as council and even staff to have some time to digest what should be a guiding document. I do see here that it was from Infrastructure Solutions Inc. that prepared that for the previous council, and I guess all of us in the township. Anyway, I think if we just took a little bit of time processing this, understanding where we are now in relation to where the projections were, and seeing this as part of our 5-year review in 2026 makes a lot of sense to me.
Go ahead, Deputy Mayor.
Well, I see on page 119 of today's package that we've already approved 70,000 for a master water plan. I'm not in support of putting this off if we've already approved it. We have a lot of housing projected to go in here in the next year or so. So and it's coming in under the budgeted amount, so I would be in favor of proceeding with this as it stands.
Thank you, Deputy Mayor. Anybody
Can I
else?
ask clarification? I thought that 70,000 was for the study that's happening now, and then this was a request for a further level of study. If we could get clarification through staff on that one, I would appreciate it.
Go ahead, Dave.
I confer with our interim treasurer who's present today.
Sure.
Sorry, I missed the question.
I'll pose it. So my understanding, when we asked Lucy the original question, just to provide clarity, what do we need to do to be in a better position with our water infrastructure today? It was that we needed to start with a water model study, which is what we did in 2024. That started. So that water model study is ongoing, well, it is complete and it will be to council. The next step was to do a master water plan. And as identified in this project, because we started asking some questions, what information goes into a master water plan? Once we saw the final document, the draft document, I should say, of the water model study, which has identified what is most appropriate for replacing the infrastructure at the Grafton Water Facility. And it was that the majority of the information that you put in a water model study ultimately ends up in the master water plan. And that's why I brought this report to council, number one, to identify that, but also two, to seek direction on which avenue would you like us to go. And staff remains committed to do a full RFP process for this if that is council's wishes. So the question to our interim treasurer was that in 2024, was there money approved in the budget for the water model study? And the 70,000 that was approved for the 2025 budget, was that for the master water plan?
That's correct. So I sat down with Adam at the beginning of the budget process, and he suggested.
Sorry, you're going to need to be on the mic. Sorry, Aaron.
Push those guys in the room.
Sorry. At the beginning of the budget process for 2025, I did sit down with Adam to go over the water budget. And he had determined at that time, I don't know year frame, that there was a 3-step process, and that the first one had been reached, the second one was, I believe, the model, and then the third one is what we're talking about today. And so it's a 3-part study to bring it all together, and then the 70,000 was put in the budget for this year to cover the cost of that.
Of the master plan.
Correct.
Okay, that's what I thought.
Sorry, yeah, that wasn't clear in what I was reading in front of me. Sorry, and how much was then the current, what are we getting, I see water master plan and water, municipal water system review. So are you saying there was 70,000 to complete both of those studies during this calendar year?
No, there was 70,000 for the master plan put aside. That was under the capital items.
And the way I read it, that the extra work could be done in including phase 3, I guess is what we're calling it, which is the equipment, all with the $57,000, and $57,000 added to the water model study. That's what I'm really confused.
Mayor, my understanding is that it's added to the water model study as a separate program.
So it's another $57,000 to.
It's 57 of the 70 that was put aside.
I'm still what you do. We got put away $70,000 to do phase 2, which is a water model. So 70,000.
70,000 for the third process,
Master water.
the master water.
Oh,
The second one is in progress or has been completed. I'm unsure.
where
on
did the
that
money
one.
come from that, from 2024? Go ahead.
Through your worship, that was my question, is what did we budget in 2024 then for the water modeling study, which was the first one?
That would have been in 2023.
So in 2024, there was 25,000 put away for a feasibility study for the water tower to include in the 2024 budget.
Which I'll ask the question, is that ever done?
I can answer.
I don't think that was ever done.
Not the water towers.
Yeah, we've never done.
What year was that?
2024.
Specifically, what was it for?
It states 25,000 for feasibility study for water tower to include in 2024 budget.
I can provide document or clarity with them.
Please go ahead.
So the information provided was that the ideology of a water tower or the needs requirement for it would be addressed within the water model study. And I do know that to be true, receiving the draft report that will come to council.
Sorry, it's not letting me hear anything else.
Go ahead, Greg.
Well, just reading the report and recalling from being on the water committee, it says in December of 2024, this company was hired to do the water model study. And that was the money that we had set aside for that. This now, the water master plan, is in addition to whatever the water modeling is.
Mm-hmm.
And at that time, it was talked about by Lucy, is if you're doing them, it's probably better to do both of them together because whatever company done it could theoretically save money because they're some of the same stuff that's going into the same report. This is asking, I guess the only concern I have about this is it's not a budgeted thing for this year, I don't believe. And I guess the second thing is should it technically go out for an RFP, because it is quite a large amount of money, we're looking at $57,000. More than likely, the same company will bid on it and get it because they probably got 50% of the work already, but whether we want to sole source them, or I think it's, my view is that you still put it out there to find out.
Anything else?
I'm trying to go back into stuff I didn't produce, so.
One more comment to the other issue when we talked about it at the water was whether or not there would be provincial grants. Because it sometimes there's things that open up to say if you're doing a study for your water, this or that you're eligible for. So if we could, I don't know if we put out an RFP now, if there's even grants available now, I don't know if there is or not, or do we budget it for next year and have them do it and see if there's a grant that comes up then?
Mayor Lobo, I only see here on page 119, council approves 70,000 in the 2025 budget for a master water plan. So reading this, it's already been budgeted for.
Well, I don't know if I agree with that.
I'm just reading what I see here.
Yeah, because isn't what we're, $57,000 is to investigate what equipment we need to purchase or plan to install, et cetera, et cetera. But I.
Master water plan and items described.
So could we defer this, Mr. Mayor, until, obviously, if you think that's not very good or whatever, and we could defer this to next week where we could have some more clarification on what we did budget for this year?
Okay, you gonna make a motion?
I'll make that motion to defer.
Second, and also, yes, how much we spent already on the existing study.
I expect we're gonna learn on that next week.
Yeah.
Any further discussion on the motion? All in favor? Let's carry it. So the motion was carried. Next week. Next we have a 10-year award mobile column lifting system. Stefan's got a report there. It's pretty clear, but anybody have any questions?
We moved on to the.
Yeah, we're here on the.
Okay, perfect.
This is for the lift.
Morning, Mayor and Council. Yeah, so this is just for the procurement of a new column lift system or hoist system for our mechanic to perform maintenance on township vehicles across many departments. Majority of all the content is within the report. I'm just here to answer any questions.
Thank you, Stefan. Any questions? I'll read the resolution. That the Committee of the Whole receive report PW 2025-14 tender award mobile column lifting system, and the Committee of the Whole recommend to Council the tender T5 2025 for the supply and delivery of a mobile column lift system be awarded to ISC Canada Group Holdings Incorporated in the amount of $109,714. That a bylaw be brought forward by council for council's consideration to authorize the mayor and clerk to enter into a purchasing agreement for tender P05-2025. Proven and seconded. Moved by Deputy Mayor Stover, seconded by Councilor Ainsworth. Any discussion? How long does it take to get that, you know?
Just off the top of my head, I believe it was 4 to 6 weeks delivery from approval, so yes, official approval.
All in favor? That's carried. Christmas present for Bill.
Last for a long time.
Okay, next we have the financial reports for 2025. And we have we recalled you a few minutes ago, our interim personnel person. Now you've got your other hat on.
Yep.
Well, go ahead.
This is pretty straightforward. This is just our Q2 financials coming forward, till June 30th, from the beginning of the year. And I asked each of the managers to kind of go through their budgets and see where there were some extra revenue above budget or below budget, and to speak to any of those concerns.
Anybody have any questions? I have a comment. I found first of all, I found the comments were very explicit, and people seem to know, staff members who did a good job in getting those responses back. I did appreciate the picture, the additional information that was sent out yesterday, although I didn't get a real long time to understand it all. One thing I do find a little bit confusing here. When you put in the minuses and the pluses and then move from one column to another, I find it difficult to understand. So I don't know if you can make it easier for me, and what I mean is, it would be nice to see the budget items that come in, the budgeted amount that's there to start with, in a positive number. What we spent so far in a positive number, and then what's left, which I think is the end of the budget. What's left to spend between now and the end of the year. I don't know if your equipment can do that or not, but that's what the county does.
I would have to take a look at, these reports are generated right through our system, so it is how it is entered into the system as well is, actually revenues go in as negatives and expenses are plus. So they're even entered into the budget for the whole year.
Okay, this is budget actual, when it's a negative, you expect them to be budget actual to be a negative, whether it's whether it's purchased or revenue or expenses.
Revenues that are in brackets.
Yes.
Are actually revenue. They're positive. And then the ones at the bottom, the expenses are negative. So if you see a vice versa of those in those areas, then it is actually a negative. But you can compare when you look at the year-to-date to the budget remaining. If there's budget remaining, then it is a positive. If it
In where budget remaining?
In the budget remaining. So you have all that information in front of you. So if you look at total budget, all revenues go into the system as a negative. So they're vice versa.
Okay.
And expenses go in as positive.
Anybody else have any? Go ahead, Catherine.
I'm always in hoops that somehow the document that the mayor records didn't get onto the agenda package until last night. So, and I was at 4-H last night, so I haven't had a chance to look at it. So I'd like to reserve the opportunity to ask questions about that in the future to you. And I know I take your point well that Q3 is soon to be in front of us as well, but in case I have some specific questions, just give me a heads up on that. And the second is variances, and staff has provided some very helpful information about variances where they're over. I'm equally concerned about variances where we are under budget, because sometimes this reflects that services or something that the council was expecting to see happen hasn't happened. So I also want to know not just the variances that exceed, but the variances. And, you know, I'm not worried about the minor ones where it's 1% or something, but when we start to have things like 10%, that's my mental number, but anyway, that's my comment to that.
One comment that I would make regarding the county ones, when they're out, they always throw in the word timing, which indicates that, yes, we're still planning to spend it, we haven't spent it yet, but when we spend it, it'll throw the budget right back into what's.
Yeah. And that's what, we can definitely do that moving forward. We did not look at those ones because we knew that there were some that are not used yet, but are in the process, whether they're in RFP or whatnot going forward, that they will be used, so. We can definitely look at that now, those are.
Anybody else have any, go ahead, Mike.
To you, Mayor, under the fire department, I just had a question on if we have a fire service agreement and it's not being collected for 4 years, does that take into account for increases of each year just because of the cost of everything going up?
Go ahead, Dave.
Through you, Mayor, Council Andrew, so, the agreement that we have with AFN remains the same. Year after year, there is no provision for increase. The reason why you're seeing 4 years there is because during our cleanup of some financial documentation, it was determined that the AFN was not invoiced. So we invoiced them.
So should that contract be renewed because of cost?
The contract will be addressed as part of future communications and negotiations with the AFN. Your fire emergency services contract remains unsigned now 6 years.
I think it's appropriate that we do get that cleaned up and get up to date. And perhaps we can put in a rider when we do that, it's after we establish a good number to start with, with a 5% or whatever increase, because it should be catching up.
To you, Mayor. So, you know, I think last report was saying that their fire services increased 25%. So why did the budget increase 25% of the contract?
That's why it's hard to get the
Already figures are getting more buildings.
Good question, thank you. You got it.
Just following up on that, we haven't had a meeting with our peers from Alderville recently. I know it was interesting when we had our lady here on the archaeological piece, but, you know, we've done that previous years, we should probably do it again this year.
Just for clarification, staff have met with them regarding the property exchanges, et cetera.
No, I'm saying our peers,
And
yeah.
I think it would be appropriate to meet the new council.
Exactly,
That's a
exactly.
good thing. So if staff would prepare something like that, and we get together and just find out what's going on with them. And if we can do that this year, it'd be perfect.
Do we need a motion for that, or is that fine?
All right, first of all, let's get back to approval of the financials. It is recommended the committee of the whole receive report FIN 2025-07, June 2025, Q2 financial report for information. I can move it a second. Moved by Deputy Mayor Silver, seconded by Councilor Booth. Further questions? Comments? All in favor? Motion is carried. Next one we have is 11.2, which is workplace bullying, harassment, and violence policy. And this morning I was asked by, or told by staff that the report is not available just yet, so we'll put it on another meeting, probably our next one. Next one, is 11-4, so what do we have to do, just, postpone or officially do anything? Okay. 11-4, multi-year accessibility plan update. Okay, sorry, thank you. 11-3, there's a notice of motion requesting for Northumberland County Council regarding 2026 budget, staff review of service contracts with Northumberland County. Mike, you want to take us with this?
Yeah, thank you, Mayor. So through you, this is a motion just to reiterate, how the costs are.
Can I get a move in the second? Mike, I'm just going to move. Deputy Mayor, second. Go ahead, Mike.
Yeah, so the motion is just to reiterate how the cost of living has gone up for, residents are feeling it in their pocket and in their home, and finding it hard to make ends meet. And this is just to, check all our boxes to make sure that we're not asking for things that we don't need, and with the residents in mind. So any kind of projects or anything that is going on, that they reevaluate whether they need them or not, and also with service contracts that we have, as far as is there anything out there that we can compare to or improve on?
Thank you. You got a mover and a second. This is probably a question for me as much as anything. I agree with you 100%. Like, there are expenses that are continuing going up, and probably people's paychecks are going up at the same rate. I can assure you that we've had county council has had more than one. I believe the next one will be our third meeting on budgets and how we can keep them to a minimum. So it is, we are very conscious of the expenses. Just to clarify, we don't, those aren't charges that the county sends us to pay for. Those are actually tax bills, and they're based on the same tax base that we are, except for that it's the county's expenses. And all that cost is distributed between the different municipalities, and it's all based on the property assessment value by impact. So if you have it should be, if you have a $300,000 value in our township and a $300,000 value in Hamilton Township, for the townships, you will get a different tax rate because it's based on what impact feels they are. But when it comes to the county, that should be equal, basically. That's my understanding. But I think it's a great idea that and there are some contracts that we deal with specifically with Northumberland County, and to come to mind is PIS, stuff from PIS, and IT contract that we had. I don't know, do we have any contract? We probably do.
Just the IT one,
And GIS. So, but I think it's appropriate that we send a letter. It certainly doesn't hurt to send a letter and ask them if they can look at those things.
Yeah, and also, Mayor, at the end of the day, we're sending out the copy to our MPP, David Piccini, and the rest of our municipalities, and see if we can gain their support.
Yep, we can do that. I'll finish reading the staff be directed to send a letter to Northumberland County on behalf of the Township of Alamos Alderman requested that the 2026 county budget be developed in a manner that is in-depth, accountable, and fiscally responsible, prioritizing legislative requirements and limiting the inclusion of optional projects and services, and is mindful and respectful of the current economic pressures and financial demands faced by everyday ratepayers, and the staff be directed to review existing service contracts between the Township of Alamos and explore alternate options for receiving services to ensure efficiency and cost effectiveness, and that staff circulate this resolution and letter to all Northumberland County member municipalities as well as the NPP Mr. Puccini. We got a mover and a second, any further comments? Go ahead. Councilor O'Neill.
It is interesting that you said you're comfortable with this, because I'm not very comfortable with it, because if I read this, and change the wording slightly to read that staff be directed to send a letter to Illinois Alderman Council on behalf of County Council requesting that we do in-depth, accountable, and fiscally responsible, and the rest of it. I would not appreciate receiving that letter. To your point, you guys have already had 2 meetings. The 3rd meeting is scheduled. I've watched some of the budget meetings that are happening at the county, but we need to have trust. And trust says that we trust our county is doing this process, and that we are not going to step in and imply anything other than we trust and respect the process that the county's doing. I guess ultimately it comes down to, I feel like, do unto others as you would have them do unto you, and I wouldn't like to receive this from the county.
Good point, thank you. Any other comments? Go ahead, Deputy Mayor.
Through you, Mayor Lobo, Councillor O'Neill brings up a relevant point here. And I think really, if we did receive a letter like that from Northumberland County, that it might be a good thing. It might put us on notice as well that are we operating as efficiently as we can, especially when we get into a budget year. So I think it's necessary to do that. And, you know, if they'd like to send it to us, I think that we will be doing that anyway. I wouldn't take exception to it.
Go ahead, Mike.
Through you, Mayor. So, you know, bit of history. We collect taxes off our residents for the county. And we're probably, with an argument, 50-50. That we collect off our residents. So to say that, you know, if it came from the top down to the bottom, this is different. This is us saying for our residents. So we're going to sit here as a council and say that we're not allowed to stick up for our residents and think about what's going on in their household, because the county takes 50% of the taxes that are put on them from them to the upper tier. So yeah, I think we have that right to say to the county, you know, enough's enough. You know, let's think about the residents and what we're putting them through when we do tax. And if you look at the last quarter of the finance, our staff is doing that. They've already saved us $819,000 in the budget. So you can't sit here and say that, you know, that's not happening here in our own home. We are trying, and our staff are doing that for us. So, yeah, when I put this motion in, we're thinking the same thing. We got to walk the walk and talk the talk, and we're doing it. So let's just make sure that our upper tier is doing it, because they're taking the money out of our resident pockets also.
Go ahead, Councilor Booth.
Through you, Your Worship, I can see Councilor Mike, and looking at both things here, but I guess if we're gonna talk the walk and walk the talk, or whatever, how you put it, we might have been saving some money, but let's look at this council over the last 3 years. I think we're in total somewhere between 18 and 20% that we've raised the taxpayers. And I could be wrong, but I think we're looking at 6%, 6 and whatever it is. So we're somewhere around 18%. So we need to take a look at ourselves at budget time and follow the same rules, that we have some important decisions to make on this budget. And I'm hoping as our last kick at the can that we can look at this, because I don't want to go back to the taxpayers election time next time and they look at it and say, oh, you guys are at 20, 25%, you've increased the taxes. And also, I'd like, as the two members sitting across from me that sit on the conservation associations, especially like yours that you're sitting at, where we've had for the last 3 years big problems with lower Trent coming in at 30% and things like that, that you should be hopefully saying to them, enough is enough. Like, you know what, I'm done with them coming back at 30% and this and that and everything else. It's get their house in order too. So I don't mind this. I understand what Mary Catherine's saying, that nobody would like that letter, and I'm sure the county does, as the mayor said, they do the best they can. But we need to look at our own backyard too, and hopefully come budget time this year, we're gonna take some serious look at it, and with the conservation groups too, to say enough is enough with that too. Because I agree with you, the taxpayers are fed up, and they don't care whether it goes to the county, whether it comes to us, whether it goes to the school board or whatever. At the end, it's all come out of their pocket to pay for it, right?
Thank you, Councilor Ruth. Any further questions or comments? All in favor? Opposed? The motion is carried. Next, we have item 11.4, 2026 to 2031 multi-year accessibility plan update. It is recommended the committee of the whole receives report CLK 2025, 16, 2025, 2030 multi-year accessibility plan update for information. Mover and seconder. Moved by Deputy Mayor Stover, seconded by Councilor Booth. Any discussion? Go ahead.
So I'm very pleased to see us move forward on this. It's been one of those things we've talked about, but it hasn't actually done. I know that there is, what do we call the Northumberland Accessibility Coordinator who meets with the lower tiers. I'm just looking for some hope that there's some resources that we can tap into there, but what that relationship is, and perhaps even having that person come and speak to us as council so that we've got a better understanding of what's involved in this and what resources are available to assist us with this.
Mayor Local,
Thank you. Yes.
may I leave the table for 3 minutes, 4 minutes?
Yes.
Thank you.
Oh, I was at the end there. I saw Cassidy nodding. I don't know whether she'd like to make any comment on that or.
Cassidy, you have a comment?
Through you, Mayor, to Councillor O'Neill. Yes, I believe my first meeting on the Northumberland Committee for Accessibility is this month. So I will be accessing the resources through the coordinator at Northumberland County, as well as other accessibility positions within the member municipalities. I know coming from Cobourg, they have an advisory representative or a staff member. So definitely going to look at those resources. And if something at that meeting comes up and they are able to speak, I definitely will extend that invitation to them at that meeting.
I appreciate that. I know when we're a small municipality, we have limited resources and it is a complex. When you look at, you know, our website and our doors and our mirrors in our bathroom, there's a lot of details and I don't want it to be all you having to do all of these pieces. So glad to know there's resources and would like to understand better things.
Thank you, Cassidy. I'll make a quick comment on the Joan 2 years ago. I didn't know too much about accessibility, but I sat now on the county representative for the elected officials on that committee, and it's just amazing how much stuff that we walk by and we don't see, and people that have certain disabilities are affected much more than we think, and it gets into you know, you mentioned the computer. It's just a mind-boggling how you could get make sure everybody has equal opportunity to read and understand all of that different stuff. Go ahead, Mary Catherine.
Yes, and from my experience at this community center where we're sitting and we look at the two bathrooms, the one that's in the foyer versus the bathrooms that are here, we use different accessibility standards in them. So that was a full accessibility. This was an accessibility that was very much related to seniors, and there was a lot of attention paid to how they are laid out. But they were laid out for walkers, whereas the other one was laid out for wheelchairs. So I think as council, there will be some service level things that we need to be thinking about and considering.
Thank you. All in favor? The motion's carried. Next, we have the launch of the council recap newsletter, CLK 2025-18, launch of the council recap newsletter. And is recommended the committee of the whole board CLK 2025-18, launch of the community council recap newsletter for information. Can I get a move in second? Moved by Councilor Ainsworth, second by Councilor O'Neill. Any comments? Go ahead.
Just a suggestion that, to increase, we've got 211 residents on your list right now. The library actually has more people on their newsletter, so if you could reach out to the library and include a little link in their newsletter, it may encourage people who are using their service to use our service.
Thank you.
Any other comments? Go ahead, Councilor Ainsworth.
To you, Mayor. I just want to say thanks to staff for putting this together, because I think it's a great tool. And I'm looking forward to the development and growing and great way to communicate with our residents and show them that some of the people that may not have time to sit and watch and come to the meetings for reaching out to them. So I'm looking forward to this becoming bigger.
And I think you can find that there'll be less and less papers putting out about it because people are going to grab it and go over quick and then dump it from real. But they will be understanding an awful lot about what's going on in the community.
Is there, excuse me, is there, or can we put something in the works to, like maybe is there another tax letter that has to go out? Is there something that we could put in that tax letter, or we probably have, and maybe it's getting ignored, but if we had like a hard date, say you have to do this by, June of 26, but we're not sending any more paper.
Go ahead, Daphne, comment.
I just don't think that we're going to be able to have a hard date. As much as I agree that that would be desirable because their mailing costs are high, I think that would have to be, I'm not aware of any municipality that is at that stage. So I think that would be not a reasonable date, and I apologize for my earlier noise.
Deputy Mayor?
Again, I concur as well. Thank you for this. It's the more information that gets out to the municipality, to the residents, the more it's going to be a win-win. So again, thank you for everything staff is doing. Cassidy, all the fingers are going to you. So thank you so much.
Go ahead, Councilor Ainsworth.
Thanks, Mayor. So I believe that, in my opinion, I think that there's companies out there that put a hard date on this thing, and they have a lot more people to deal with than our 7,200 residents. So, if I look at St. Anne's and I talk to the owner there, Denny, he's got 80,000 people on an email list, right? And he's a business in our township, and we have 211 out of 7,000 people. So I'm just saying that because people don't have to do it, maybe they're not doing it. So it might be an option to put a hard date on it and say, listen, we are going to do this. And we got lots of time to get it social media, we got lots of time to get it out and another mail out with the taxes, and we got lots of time left.
I'd like to do it. I think it's a little bit premature. In a year from now, after people have started to use it, maybe it will be the right time. I think it's a little bit premature. I don't know. It's great to hear that St. Anne's has got 80,000 people, but they didn't get them overnight.
No, but the other option too, Mayor, would be that there'd be options with that service, you know, they'd be able to pay online. They would be able to get receipts online, you know, and so if someone came in for another receipt, it wouldn't cost them $10, I mean, so there's lots of little things that could happen with that process.
Yep, I agree. We're a little bit off subject, but I know what you said.
Yeah, no, this is great. Thank you, guys. Step in the right direction. Good.
All in favor? That's carried. I think we're on 11:16. 11:16 is the Great Pine Ridge Snowmobile Association MOU. I'm informed by staff that the map that you're seeing in front of you now has been changed a little bit. They are actually asking for less kilometers of road. So we can either describe it and approve it, or we can hold it so we can see it. Deputy Mayor?
What is the, through you, Mayor Lobo, what's the timeline for the update?
Go ahead, clerk, Madam Clerk.
So through you, Mr. Mayor, yes, the revised map was received at 8 o'clock this morning, so there was a reduction in trails. So you can go through, they were looking to backdate this to the September 1st start so that they can get in there ahead of time and start doing their work in preparation for the upcoming snowmobile season. What we can do is, if council wants, you can approve the motion as it is today, because it does still have to go to council for approval, and I can attach the updated mapping to the council agenda for that first meeting in October, which you don't lose any time for the back and forth or delays, but you'll still get that information before you make your final decision.
Thank you.
So I think we said that we can recommend approval upon getting more information, rather than
Yeah, so you can proceed with going with what's there.
Okay.
And then I'll attach that to the updated, just with the memo to council.
Okay. It's recommended the council of the committee of the whole receive report CLK 2025-15-19 Great Pine Ridge Snowmobile Association MOU for information, and that the committee of the whole recommend to the council that the clerk be authorized to execute a memorandum of understanding with the Great Pine Ridge Snowmobile Association for the 2025-2026 season, and staff will be sending you an update on that map. Moved by Councilor O'Neill, seconded by Deputy Mayor Stover. Any further discussion? Go ahead, Councilor O'Neill.
First, I'm pleased to see this, and ironic when you're saying there's going to be a map that's even more precise, because I'm much happier with this map than the one we received last year, where there was a discrepancy between what it said in writing and what it was on the map. So anyway, very pleased to see this, pleased to hear that they're going to get in there so they can deal with the trail safety and make sure that it's going to be safe and enjoyable for the users. I do have a question about when we know, and we do know, that the snowmobilers are using unassumed roads. So it's a liability question around what are our responsibilities for other unmaintained roads that we know are being used on a regular basis by snowmobilers.
Anybody want to comment on that from staff? Go ahead. Madam.
So through you, Mr. Mayor, our responsibilities when it comes to liability of using our roads are the same regardless, whether they are there for public use. So they are maintained in accordance. When your signpost is unmaintained, it is a use at own risk. So we do still have liability for people being on our properties, as we would, no different if it was a park or in this facility we're in today. We do still have responsibilities, but there's certain levels in which we are required. We're not required to go in there to the minimum maintenance standards outlines the specs in which we have to maintain on open road allowances, but it is still public, and unless they are stopped up and closed and transferred off to adjacent property owners, they are still there. So there is a signage requirement on our behalf that our manager of public works can shed more light on. But if it's as part of the trail system that you see before you here with this MOU, then that's why we've put into place here that any work being done is to be authorized by any township staff, so whether it's our Parks and Rec manager or a Public Works manager, so that we know what upgrades are happening on our properties. So for instance, if somebody goes ahead and installs a culvert, we need to be aware of that because there would be specs that we want to make sure in order to mitigate our risk. Again, these MOUs, they only affect those that are permitted riders. So if somebody is on these trails unpermitted, so they're using them unauthorized, for instance, that wouldn't be, we can't control the actual use of individuals if there's different recklessness that's going on. But one of these pieces is, again, working with our local partnerships, developing those local partnerships to make sure that we have these pieces in place so we know what work was being done. But it is, for the unopened, they are unmaintained use of them.
Go ahead, Gavin.
The thing that I heard in there that I was pleased to hear is that our Public Works manager is going to try and get some signage around these things. But I did a law clerk course, and the phrase "knew or ought to have known," that was one we were taught to use all of the time. So sure, what you are saying, the person knew or ought to have known that this wasn't a maintained road. But they're going to go and say the opposite. The township knew or ought to have known that this was being used as a trail, and therefore they had a duty to maintain it to the standards of a safe trail. And when I look at what Ontario Hydro had to pay out, I am concerned about the potential liability of these things when we are aware that they are being used as trails. Now, it would definitely lower our liability if there was clear signage around these things, but I have the trail head is right just north of my house there. That little sign that indicates this is the trail head is small, and you're up to it, and it's not meeting AODA standards at all, trying to read the small print on that sign. So I think even if you want to be a good snowmobile user and you are properly insured and you are staying, and you would go right by that sign and not realize that you had left the trail area and were on township roads instead, or Coniston township roads, because the signage that they're using is awfully small and the township has no signage at all.
Go ahead, Mike.
To you, Mayor. So maybe a little of education when it comes to these groups. So every group carries $15 million liability insurance with the township as a third driver in the park. The Snowmobile Club actually has a better clause than other motorized groups, is that they have a bill of 100, which means that any trail that they groom is now under the highway traffic act. Right, so anything on those trails by anybody else going on, it's under the highway traffic act, let alone the pass that they buy from the OFSC. So, the signs versus whether they're small enough or they're big enough, there's a variation of signs. Most of them are 12 by 12, some of them are 12 by 18, some of the ones. The caution signs are like an OFSC trail, they're the smaller ones that they use. And trails ends are 12 by 12. Much same the ones I think we were gonna, the new ones I think our new ones were 12 by 18 or something that we were gonna put on. But I think they have the code of conduct and stuff that they use for their trails and their trail riders that they get all the time. People get when they buy their pass. And the unassigned roads are there for us to use. For all the motorized groups. So, it's there, it's everywhere. So, but anyway, the insurance is there, and the background is there, and the setup is all there.
I think you perfectly made my point for me, Councillor Ainsworth. This group and these trails and this MOU are fantastic, and I want to thoroughly extend my thanks and appreciation to the Snowmobile Club for all they have done, all they do to make these trails safe and enjoyable for users. So huge thank you. That does not, it only reinforces my concerns about why we are not addressing the other trail spaces that are being used, where we don't have that insurance, where we don't have all of these safety features that you've just outlined, which I think are wonderful and needed and necessary and make it a safe, enjoyable, low-risk activity.
Thank you. Anybody else have any final comments? Like, go ahead. Is it related to this?
Just to maybe give Councilor O'Neill some answers. So all the motorized groups run off the same code of conduct. We all use the same signs. It may be different color, but we all use the same signs. We all have $15 million liability insurance. All the municipalities are all third riders in all those insurances, whether it's, Hamilton Township or Elma Calderman or Port Hope. They all are third ride parties on, because you have to have the third riders parties to be able to have the trail on this property. Or the umbrella group will not allow you to have the trail if you don't have that. So anyways, so all the other groups are the same. So the motorized groups, so dirt bikes, snowmobiles, and ATVs, all have the same policies, all have the same insurance, and pretty much the same landowners agreements.
What would you like to do?
Well, I would like to thank Councillor Ainsworth for reiterating exactly my point, that these trail agreements and the uses of the designated trails is the desirable way to go forward on this. He opens the door to the question, where are the MOUs with the dirt bikes and with the ATVs? We have the Snowmobile Club coming to us every year. My understanding was we were going to work on those trail agreements with the other user groups, so I definitely want to see that happen. I am happy to have this MOU move forward, but then when we're done, I think,
Go ahead, Sunil.
Through you, Mayor, well, this is just to provide some information to council. We have an unassumed road bylaw that came before this council that was discussed in length. Regardless of the outcome of that discussion, my understanding is that bylaw remained in place and untouched. I would recommend to this council that we have staff seek you a legal opinion with respect to what Councilor O'Neill is suggesting. My understanding that land use agreements are for private pieces of land. So if we own, which we do own some land that is adjacent to roadways within the county forest, and if we permitted user groups to go on that land, that is one set of rules, regulations for user agreements, etc. With respect to public road allowances, which is exactly what I understand to be being used, it's very nice and it's a great thing for a corporation to have an agreement with the user group. But we do have a standing bylaw that permits anyone to use those road allowances regardless of permitting. So having been involved with user groups like this in the past, enforcement was able to be done on private property where trails were used, but it was not able to be done on public road fare because it was a public roadway and the bylaw would supersede that. So I am recommending the council as a suggestion that you may want staff to seek you a legal opinion. It's really nice to have dual insurance. It's nice to be covered 100%, but there's more to it than just the simplicities of an agreement. I think it's great that our clerk has been able to advance this MOU with respect to the township and the Snowmobile Club, but there may be further work detail that needs to be done outside of this agreement, just for clarity.
Thank you. and I tend to agree with you. We're kind of giving our own opinions, and we may need some legal assistance. But I'm gonna bring it back. Are everybody in favor with this recommendation? Carry. Thank you. Next we have communications. We have 10, I believe, items, and we're gonna read off as a group. And if you want to pull any, we'll decide that after. But I'm going to read off that we received a wealth of information. The agenda items 12.1 to 12.10 on the September 16th, 2015 committee of the whole meeting. Agenda be received for information. Can I get a move for seconder? My Deputy Mayor Stover, seconded by Councilor O'Neill. Does anybody want to pull 12.2? See no interest, that'll be left. 12.3. See no interest, that'll be remain as received. 12.4. Northumberland County Prosper in Northumberland. Anybody want to pull that? 12.5. CN Rail Safety Week 2015 proclamation request. Councilor O'Neill, go ahead.
Oh, I'm just thinking that we should make a proclamation.
We should also sign that, moved by seconded by and consider that sheet. I got a mover to do that.
We have something on the floor.
For me? Who have you done that?
So if there's any question.
So, we're going to come back to this, and if there's any interest in speaking, we get a motion.
No.
Yes. Apparently, we did get a motion, who made the motion for this one?
Deputy Mayor, second on that one.
We're moved by Deputy Mayor Stover and seconded by Councilor O'Neill. If we receive all of these?
Yes.
All in favor? That motion is carried. And we've already determined that 12.2, 12.3, 12.4 were just received. 12.5, Councilor O'Neill has asked to be pulled. She's brought a recommendation. Can you repeat that again?
That we proclaim Rail Safety Week.
And a seconder for that? Second by Deputy Mayor Stover. Any further discussion? All in favor? That's carried. Next we have 12.6, the Township of Aramith. Illegal land use. Anybody want to pull that one? Seeing no interest, we'll move on. The next one is 12.7 from the Honorable Robert Block regarding preserving Canadian soil. Anybody have any interest in pulling that? Councilor O'Neill? Can I get a seconder to bring that to the table?
I will.
Seconded by Deputy Mayor Stover. Go ahead, Councilor O'Neill.
Rob Black is a world leader on these soil conservation, but the impacts especially on the environment, and that report is an important one worldwide, and it is being used worldwide, and I think it would behoove us to also use it here. I do know Rob through 4-H, so, but overall, I am speaking to support this as a document that gives us information to help us make good decisions, so we should support it on a larger scale and use it on a local scale.
Thank you. Deputy Mayor, you have a comment?
No, I think it's a great idea as well.
Okay. Anybody else have any comments? Go ahead, Councilor Lindquist.
I would just, through you, Mayor, I would just make sure that this letter complies with the new regulations for the conservation authorities when it comes to, regulation 23 and regulation 4124.
And do they? 'Cause I'm not familiar with it.
I don't know, it should be on.
Oh, can you ask that at the lower track?
Yeah.
Go ahead.
I would expect, since it's primarily focused on soil health, that is something that both organizations would, but I take your point that would be a resource that makes sense, that it's brought to the attention as well of the conservation authorities. But, yeah, soils, there's a lot more interesting stuff about soil than it's just dirt and ground.
My only comment was that, if we're supporting this, we should also send a copy to the Northumberland Federation of Agriculture to make sure.
Yes,
they're aware
for
of this
sure.
as well.
Mayor?
Yes.
If I could add to that also, does this comply with all the new changes that we talked about earlier? So it's nice to put a letter together. But if you're not complying with all the rules, then how far are we gonna go? So before I agree, I'd like to see that those all get looked at and make sure that they're complying with those rules.
So I'm not sure who you're talking about.
Well, this fellow here, Mr. Black.
Know who Mr. Black is? You know who he is?
Yeah, the Honorable Mr. Black.
That is municipal affairs and housing, so I'm sure he's got all of this covered to all of his people.
Sorry, this is coming from the Senate of Canada, and yeah, it's already been endorsed through the Senate and through the federal government, so I'm not concerned that this is,
Federal or provincial?
it's coming from the federal level, but again, I reiterate, it's focused on soil health. I am glad to hear that you think we should share it with the Federation of Agriculture. I'm sure they've seen it, but I think it reinforces that we care about their issues.
And I realize that Honorable Robert Black is a provincial minister, but it does say preserving Canadian health, soil.
Sorry, no, he's a senator. He's a senator at the federal level.
Oh, I'm confused here.
That's what I'm saying, the federal and provincial, two different things when it comes to this.
Who's the Minister of Municipal Affairs and Housing?
Robert Black.
Robert
Yeah.
Black. Pardon me. Black. Okay, we're way off subject.
Yes.
All in favor? That's carried. Next one, County of Northumberland supporting for expanding colleges of physician and surgeons of Ontario licensing communities. Oh, that's not being filled in.
I'll pull that one too, and it seems to be the one that's keen on pulling things today.
Okay, go ahead.
We need a second first.
Okay, you second it.
Sure.
Councilor Booth.
I'm sure that Councilor Booth will have much more to say about this once their new committee starts forming, but this will definitely be something that they are advocating for, and I think we should give our support for advocating, because when we were on the physician recruitment board and we counted how many doctors were living within Northumberland County who were not able to practice within Northumberland County, and that the process was going to be years, not months to get through, making that so that it's going to be through in a couple of months as opposed to a couple of years would be a huge help to what we discussed earlier in this meeting,
So is there a motion then?
that we support this.
Okay. Go ahead, Mike.
To you, Mayor. although I think this is a great idea, you know, I kind of wonder what it's gonna cost the township eventually to do this over the years, and I also wonder what it's going to, you know, this is provincial based, you know? Should this not be like, pushback on the province? And, you know, there's another avenue out there that no one wants to really talk about too much, but I shouldn't say no one, but, it's a naturopath, right? You know, me personally, I don't want to see a doctor unless I break my leg. Right, so there's so many things out there now with naturopaths when it comes to flus and colds and parasites and everything else that's out there. Right?
Yep.
And there's more and more and more facts coming out from doctors that all this stuff works instead of pharmaceutical medicine. So it's a whole other avenue that should be involved in this, and we're just ignoring it. So those few things, and whether I know we should support it, but how much financially is it going to cost? If you know, and even with the last group, did we ever get a physician out of those how many years that we were paying into it? Right, so there's got to be a.
So I think it's important to stay focused on the motion that is on the table. With regard to the physicians, yes, we have been able to replace doctors. We were never able to expand the number of doctors, but as people were retiring, we were indeed able to fill those positions. We're in a little bit of a pickle now because there happens to be a huge number of retirements happening at the same time, which reiterates why allowing qualified doctors who are already living in this area to get through the process and become practicing in Northumberland faster would be a great thing to advocate for, and I do not see how this would be a cost to us.
I'm going to call for the vote because I'm trying to get this meeting done in the next 12 minutes. So, all in favor? Opposed? None. Motion's carried. The next one is 12.9, advocacy for increased income support for Canadian veterans.
I will put my hand up for that.
Okay, go ahead.
Well, I think,
Oh, you need a second.
I do, I have it right, I'm right beside
Sorry,
me.
Mike had his hand up too. And I'm sure
I do know there was a point, and I don't know how the amount of money that is lacking in to do with our veterans, but any way that we can support our veterans, I believe, is paramount to making the proper decision before us, and that is to support them.
Any further comments? Go ahead, Mike.
I 100% agree. I mean, you know, we could go into the weeds of this pretty far if we want to, but I just, you know, basically, our veterans are forgotten. And we need to do something to change that. And we need to support them financially. And with benefits. So, 100%.
All in favor? That's carried. We've got to go into, no, there's one more. Township of Rundell, Lindop, and Raglan. That's regarding exemption to proposed mandatory firefighting certificate requirements. Somebody want to pull this? Seeing no interest? Oh, did you want to do something, Mike? Oh, sorry. Go ahead.
Yeah, just,
Well, I'll get a, you want to?
just for a motion, just to.
Need a seconder?
I'll second.
Second by Deputy Mayor Stover. Go ahead.
So, this one here, not that I want to support it, but I just want the ramifications of not certifying the firefighters. Right? So, as a township, with, you know, we're looking to try to get 60 firefighters, and if we were to follow something like that and not certify the firefighters, how much litigation that would cause. So, you know, thanks to our CEO/fire chief for doing what he does for our firefighters in the township and keeping everything up to date. And that something like this might try to hamper those Anyways,
So you're just expressing, but.
I just want to bring it on to express the fact that it's ridiculous.
But you're gonna support?
No.
Okay.
Are you withdrawing it then?
No, we said a vote no.
You got it.
Vote it down.
No, we can just withdraw.
All in favor?
I thought we were finished. I'm in favor of moving
The
on.
motion is defeated.
All right.
13.1, motion to move into closed session is recommended the council of the corporation of Township of Allen and act as follows. That the committee of the whole meetings of September 16, 2025, moving a closed session under section 249, 2-1, information supplied in confidence by a third party. To transfer over into closed, and that'll mean we'll have to eliminate the public, sentence.
Mover and seconder?
I need a mover and a seconder for that. Moved by Councilor Booth, seconded by, going in close, need a seconder. Seconded by Councilor Ainsworth, all in favor? Motion carried.
You're good, John.
Okay. Report out of closed session. Council met in closed session and provided direction to Mayor Vogel regarding police training exercises in the township. So our final motion of the day is motion to adjourn with the committee of the. Motion to receive the report. Okay, need motion to receive the report. Moved by Councilor Booth, seconded by Councilor Ainsworth, all in favor? Motion is carried. It is recommended that the committee of the whole receive Mayor Vogel's report from the closed session for information. Motion to adjourn that the committee of the whole meeting held on September 16, 2025 be adjourned at 1:35 p.m. Moved by Deputy Councilor O'Neill, seconded by Deputy Mayor Stover. All in favor? Motion carried. Thank you, everyone.
Thank you.